I'm very happy that I'm meeting you today, so we can share our experience and information. And this is going to be the first video conference that is a special edition of Merck Africa Asia Luminary 2020. Since we had to postpone our conference, which was supposed to be held in Zambia, because of course the coronavirus pandemic, we decided that to have separate sessions of different fields and under separate different programs together with you, so we can catch up and share information, experience, and also it will be an opportunity to congratulate you for you being selected by the scientific committee to be enrolled in the 1-year online diploma in Southwest University for the Sexual and Reproductive Medicine. And I think this course is going to be transformational. Transformation of the landscape of fertility care in Africa. It's going to be also a very great milestone for women's health in general and fertility care and reproductive health in particular. Something that I'm very passionate about because it's a critical part of Merck More Than a Mother campaign. You know, this campaign is very close to my heart, which we started in 2015, and there is almost 17 Merck Foundation Alumni already was with us since a long time, maybe from 2015 or 16, from different countries. But we also have new candidates who are going to be joining our campaign and our noble cause of breaking the stigma of infertility and improving access to equitable and quality fertility care in Africa and in Asia. This is very important because it's not a simple training. This is a 1-year training which is going to really enhance your skills and practice. And this will reflect on people, reflect on couples, reflect on women, reflect on their quality of life, psychologically and physically. I know that we are together will make history. We already made history before because, as we said, there was alumni that we provided to them before clinical fertility care, and they were the first fertility care experts in their countries, because in some countries there was no even single fertility care expert, or even sometimes gynecologist, like for example Liberia and Gambia, and we trained the first, and this is a history in the making still, because now we are even expand to 96 doctors from Africa and Asia, and this is not the end. This is only stage number 1, because we're going to be more and more in the years to come. 96 doctors who is going to join us today. 17 out of them was already provided by clinical fertility care and specialty training. And the doctors who you are, and we are proud of you, and we salute you, because you are going to make the change. You are going to be the change maker, and you're going to be the voice of the voiceless, and you're going to be the resort for people who didn't have any place to go before. They are going to find you. You are working and accessible to them. So from countries which I'm going to mention now: Bangladesh, Botswana, Gambia, Ghana, Kenya, Liberia, Malaysia, Myanmar, Namibia, Nigeria, Philippines, Rwanda, Sierra Leone, Sudan, Uganda, Zambia, and Zimbabwe. All these countries, we have a very strong partnership with the first ladies of Africa, when it's African countries, or ministries of health, education and information and gender, or fertility societies, which is very, very important instrument to be able to find the right persons, find the people who's passionate about this cause, and will add value to their communities, and we will support infertile women and infertile couples. The main thing we want also to focus after our training is to do following things. Raise awareness about fertility prevention, since there is around 85% of fertility caused by untreated infectious disease. This information might be known for us, but is not known for majority of people in the African and Asian communities. In our communities, I didn't know it before I specialized in this field. And hence the prevention is very important. And you're going to be also the champion in your community and your clinic, in your hospital, in your country, to raise awareness about this, either through your inner circle and patients, or through the media and social media. Also raise awareness about male infertility, because as you know, there is a lot of doctors who are not, there's a lot of people, men, who are not yet ready to admit that they can be cause of infertility, due to that it is very much linking to their feeling of manhood and masculinity and all this, which is wrong. And we want to make sure that they understand this. We make sure that we encourage them to speak up, to encourage, support their wives, and join the journey of fertility care with them. So we don't want to see anymore someone who enters a clinic, a woman by herself, without her husband with her, without his support, without his respect. We also want to break the stigma of infertility, either for men or for women. And make sure that women are more than mothers, and everyone look at them this way, that they are more than just mothers. Men are more than just fathers, and both of them are productive members in society, whether they can have children or not. And this has to be the message after your graduation, after you start to run your own clinic and be the change maker in your community and in your country and in your continent. These three things in nutshell is the main objectives of the community awareness and the objective of Merck More Than a Mother, which is the signature campaign of Merck Foundation. As a CEO of Merck Foundation, I'm very proud of you, and I'm very, very happy that this army of strong experts are going to be very soon in the field in many countries, and not only you, but going to be more to join you. I want you to help each other, and I want you to connect with each other. And because this is the fact that exchange knowledge and sharing information and networking is also a key, a factor for the success, and to help the people to come who will going to join these programs. And of course, we will also look at see who want to be complement these programs with the clinical practice after the coronavirus pandemic. Of course, in the beginning, I should told you to keep safe and healthy, and it's really happy to meet you in this time. But because we said that many times, we just get bored of saying it, because it become a matter of fact actually, and a part of our life. I hope it's not anymore. I hope in the beginning of next year we will be able to move freely and see each other, and I come to all the countries and meet all of you, and we can discuss further, and we see your testimonies and success stories face to face, and we have a lot of meetings, exchange of ideas, and new projects together. So before I end, I just want to see if I gathered everything. As I said, there was 17 older alumni, Merck Foundation, and the rest of the 96 will be the new Merck Foundation Alumni, the new future experts of fertility care, and from the 17 countries I mentioned. By the way, I am also trying to find the same course for French-speaking countries and Portuguese-speaking countries online. It's very difficult to find it. Really, I looked very, very hard, and I don't want to leave our colleagues and our alumni who is speaking other than English, French, or Portuguese behind, because they need also to improve their capacity and to have this opportunity of helping, enabling them to help their communities as well. Especially they are taking it very serious. For example, we just celebrated last week the inauguration of the first public IVF in Niger. And this was instrumental by the First Lady of Niger, Ministry of Health of Niger, and the trainees we trained in our clinical fertility care. This is very, very important for us. As well as we also celebrated the success stories of the first public sector, IVF sector in Rwanda, with our colleagues from Rwanda who are also going to join this program, but they also trained by our program, through our program, our clinical fertility specialists and embryologists as well. We are going also to focus on embryology training, and this is you're going to hear about it very soon online, but this is not going to replace the practical training, which is very important, and I believe in it very, very much. Of course, the same diplomas, it's in different fields, which is not, of course, related to you, because there was also diabetes and cardiovascular, endocrinology, respiratory medicines, and acute medicines. And this is very, very important also. So you are not going to be alone. You will also be joined by an army of clinical and healthcare experts in different fields. So now, thank you very much for having the time with us. And I think I will call, I will look at you, because each one of you has the time to speak and to share his experience and testimony. I will start alphabetically from A to Z, and we'll start with Bangladesh. And there is Dr. Florida Rahman. She will share with us two things. First, the challenges in her country, because in each country we selected one person who will share the overview about the country and the challenges and the impact of this training that's expected and estimated to his country or his community. And then I will call each doctor after that from the same country to have 3 minutes intervention. And then we will start after that with Botswana, Gambia, then Ghana, then Kenya, Liberia, Malaysia, Myanmar, Namibia, Nigeria, Philippines, Rwanda. So I will alphabetically until we reach to Zimbabwe. I want to encourage you to study hard this program, because it's a difficult one. It's not easy, but it's going to be very beneficial for you, very, very beneficial. And based on the grades you are going to have, the highest grades will be invited with us to our conferences and other activities, because as you know, we are increasing in number at the moment, and this is not going to be suitable to have all of us in our annual conferences and other things. So we are going to use a parameter which is the highest grade. We will select the highest grade, and is going to be invited with us this next year to our annual conference in Zambia. So I want you, and of course you will see us in person, of course, in your countries as well.
I'm Dr. Florida Rahman from Bangladesh.
Thank you, Dr. Florida, and I will invite you to have your intervention. And I'm very happy to see you today. And I know that we had a lot of cooperation with Bangladesh. We trained many doctors, and we're still doing it. And we would like to see, for us to share information about Bangladesh fertility care challenges in Bangladesh with all our colleagues, because maybe many of us or many of our colleagues and alumni never have any information about Bangladesh before. So it will be very interesting. Thank you.
Good afternoon, and my respect and gratitude to you, Rasha College, and to Merck Foundation. I'm honored to be here and to say something about our country. Okay, Dhaka Medical College. I am working in Dhaka Medical College for many years, and it is the largest, most tertiary level hospital in this country.
Yes.
There are 2,600 beds in our hospital, and for infertility, we have only 18 beds. But we have developed a separate reproductive endocrinology and infertility unit since 2019. And all the outdoor facilities, including outdoor management of IUI, was started since 2016. And we have many statistics in every year. In every year, we treat about 15 to 1,600 patients.
Yes.
And we do IUI in about 40 to 80 patients per year. But our success rate was not so much promising during the last 3 years. It was about 5 to 6% for all patients, and for IUI it was about 16%. So, but my turning point of our journey is the visit of Mr. Venunier from Merck Foundation to our country. He visited our hospital, and then a meeting was held, and they select me as a clinician trainee.
So, Merck Foundation turning point.
Yeah. So yes. I was selected for higher advanced therapy training in Bangalore under Dr. Kamini Erao. He's the great infertility specialist. She's the great infertility specialist, and my training was very rich and effective. I am very grateful to them for teaching me. And
how many eyes was trained with you, Dr. Rahman, Florida, with you from the same country?
Clinician from Dhaka Medical College. There are 2 clinicians that are trained by, sponsored by Merck Foundation, and outside of Dhaka Medical College, another doctor. He's near to retirement, Dr. Joglul Haidar. He's also trained by Merck Foundation, and Dr. Musammat Shahina Begum Shanta.
Yes. She's also with us in that. Yes. Yeah.
But you have given training to many embryologists.
Yes. How many? Do you remember?
I can remember at least 4 to 5.
4 to 5, and this is added value to the success of the cases and access for patients.
After getting training, I was trying hard to establish our IVF center with my director and my head of the department. She tried hard, wholeheartedly. They tried, and ultimately we became successful, and we have started our own IVF center, and which was inaugurated in 2020, 10th August.
So congratulations.
Thank you very much, and I think it's your help.
Thank you.
Without your help, we cannot go ahead to at this limit.
I'm so happy to hear this. And is it a public center? It's public, yeah?
It's the public center, and all tests, all ultrasonogram, these are done at free of cost. And the IVF cost of IVF is not yet certain. So in our private sector in our country, it's very expensive, about 2 lakh to 3 lakh Bangladeshi.
Yes, the same way in Africa. So we can say this IVF is the first public IVF, or there was more public IVF before?
It's the first public IVF in our country.
And this is a history in the making, and we are very happy to hear this, because it's very important to have this service and this care, fertility care, as a productive right and human rights in public sector, accessible to everyone who cannot afford, which is very, very important. And you are the champion and
Thank you very much.
the hero of this with our alumni. Thank you very much, Dr. Florida, for this information. Maybe I would invite now Dr. Ranta Paul to give her intervention.
Thank you, Rasha Kellis, for giving me the floor. I am Dr. Ratna Pal, working as assistant professor in Dhaka Medical College Hospital, and one of my colleagues is Dr. Florida Rahman. Just before told something about our hospital, and it is a tertiary hospital and big hospital in my country. Is there only IVF center in government sector, and is open 10th August, just near about 1 month back, 1.5 months back. I am grateful to Merck Foundation and you, because Merck Foundation trained many of clinicians and embryologists in my country, and they select me and they give me the opportunity to take this training. Again, also thanks Merck Foundation, because my country is 80% of the population of my country is poor, and they cannot able to take in private sector, because in private sector money is about around 2 to 3 lakhs in Bangladeshi currency, and they cannot able to bear. And in my hospital, only just consultant and ovum pickup, ICSI, embryologist, and all sonologists, all are free. Only just to give just some money for injection. And I think our government is trying to give us to some injection for our hospital. And today and tomorrow, our IVF center is established, hopefully, and this is a big center in my country, is a government sector, and this is all possible for Merck Foundation, because Merck Foundation trained many doctors, and 3 of them are we are attached in Dhaka Medical College Hospital. So Merck, I am able to complete this training if they select me diploma training, as well as postgraduate diploma in sexual medicine. They select among it. Is a very, very big platform for me, and they elaborate the subject, and this is a I can apply my knowledge to serve my patient in my country. And I also thanks Merck Foundation, many thanks, and thanks also Rasha Kellis, and thanks my colleagues and others. And
thank you, Dr. Ranta. I am very happy that this is a good news. In 2020 August, you open your IVF during the Corona time, which is amazing news. And don't worry, we are going to be with you and record your success stories. I know that you sent me few pictures of the first baby.
Yes.
It was amazing, and we are going to an album of this, and we were going to share all the success stories of the women that you helped, that didn't have any place to go before this IVF, and you helped them to achieve their dreams and to break the stigma around them and have this access. So this is really good. After we finish this video conference, we will schedule certain videos, planning with the people who's already graduated from our clinical. And we will do the same, by the way, with all the graduates from the online diploma as well, after they graduate, to see the impact on the community. Thank you very much for Dr. Randa. I would like to call now Dr. Shanta. Thank you very much. Thank you. Dr. Shanta, Musamat Shaina, Dr. Shanta from Bangladesh also to have her intervention. Or his, yes?
Yes, I'm here.
Yes, Dr. Shanta. Yes. Great.
Thank you. Thank you, Merck Foundation.
I can hear you, yes.
Dr. Rasha Teles, though I'm not physically fit, I have high-grade fever, but I was interested to attend this program, Zoom meeting. Actually, I'm working in a private hospital, and I have long experience to work in a tertiary level private infertility center of Dhaka, Bangladesh. And I also received short training from India and Singapore also regarding infertility. Last year, I got the training for 3 months for advanced ART training for clinicians sponsored by Merck Foundation. After that training, I'm trying to establish my own IVF center, but yet it is very difficult for me. I'm doing IUI, after IUI here. Each month, 4 to 5 IUIs I'm doing. I have a plan after finishing this PG diploma to establish an own IVF center. I already work with my hospital authority. Just now, they are not so much interested. So that's why it is not yet see the hope of life. But I actually trying, and I find that is my dream that I will establish my own IVF center to serve the people. Though our government sector is becoming highlighted day by day, Dhaka Medical College started already IVF center. And they told that they started IVF center from August 2020. It is hope for our poor people. Though Bangladesh is an overburdened populated country, but infertility problem is increasing day by day. That's true. And our people are not so much financially affordable. They cannot afford the cost. In private sector, the cost is high. But I have a plan. If I can establish my own center, I will reduce the cost to lowest minimum level, so that our people can, at least middle class people can receive the infertility service from my center. And I have planned to do some free IVF. And I'm doing free infertility treatment for poor people in my center, and as I'm not doing IVF, so that is my dream project.
Thank you very much, Dr. Shanta. You know, one of my dreams also that the doctors in Asia can cooperate with doctors in Africa, and even within African continent, within Asian continent, that we can help each other and cooperate with each other. And this is really a dream, but this is the reason why we have this alumni. So this alumni is connect all of us together and share our experience, share our challenges. If we have challenges or problems, or we can find solutions with each other, which is really good. So I thank you very much, Dr. Shanta. And now I can call Dr. Farzana Khan-Koni to also, she's a new applicant, a new candidate, a new alumni. And I would like to call her to share her experience. Not experience, but maybe share her anticipation and the anticipated impact of this training. And why this training or this course or this diploma is important for her and for her country.
Okay. I'm Dr. Farzana, working in Fertility Center, topmost infertility center in your country. Throughout our work, I came across many couples suffering from infertility for a long time. I have many years of relevant academic and practical experience. I have hands-on experience of conducting IUI, ovum pickup, and embryo transfer. I am also doing a diploma in reproductive medicine and embryology from Germany. This fellowship program to be the most suited to nature my speed provide a solid foundation for my career and enable to conduct for future research in ART field. This subject and cherishing a dream of becoming a successful IVF specialist in my country.
Thank you very much, Dr. Farzana, for your testimony. I'm sure we are going to meet again for you to tell us the impact of the training on your practice and also on your the patients of Bangladesh you are helping. Thank you very much, Dr. Farzana. I think now we have finished Bangladesh. I'm so happy, and I'm going to come to visit you after Corona, so to see the new IVF, and it will be really, I will be very happy to see this, because it's an achievement, your achievement, but also I consider it an achievement of Merck Foundation and personal achievement for me, because this is very much as a personal objective for me to see your success, part of my success. So it's really important. Now we go to Botswana, and I'm happy for Botswana because I know that there is a very limited number of gynecologists, maybe not, there is no gynecologist in the public sector. This is information that is going to be corrected by our colleagues who will join us now to tell us the impact of this training and diploma on the women's health in Botswana and reproductive and fertility health and care in the country as well, and how this will help women in general, and the stigma of infertility, and how the infertility of stigma in Botswana, is it the same like other countries in Africa or different? This is what Dr. Fuselhal Mosadami will tell us now.
Okay, hello everybody. My name is Botlhale Mosadami.
Great, Botlhale Mosadami. So it's really easy to pronounce. Thank you.
Very easy. You're welcome. Thank you so much, Dr. Raja Khalej, for this opportunity to be able to speak. So, like I said, my name is Dr. Botlhale Mosadami. I am a young female who's currently working as a medical officer or medical doctor in the public setting. I work in a 24-hour clinic, a very busy 24-hour clinic. I see general outpatient clients. However, I'm very passionate about reproductive medicine. So when I saw the opportunity from my government to apply for this course, I immediately jumped at it, simply because as part of seeing my general outpatients, I have been noticing a steadily increasing amount of women who have been having problems with conceiving, whether they are nulliparous, they've never had kids, or they have one kid and they realize they cannot have any more kids after that. So it began a search in which I wanted to really find out what's going on in our country in terms of our fertility. So my research led me to very few statistics, unfortunately. However, the United Nations does have some statistics to say that the average rate of women having children in Botswana is actually 2. So that rate has actually dropped from the average number of 6 children to just 2 in our country. And that was the only statistics I was able to find. Currently, as it stands in our country, we do not have in the public setting a IUI or IVF center. It's not available.
Like what about gynecologist? Do you have gynecologist?
Right. So like you rightly mentioned, one of the biggest challenges is we don't have enough gynecologists. So where I work right in the center of the country, and the nearest hospital to me does not have a gynecologist. However, when I need to send a patient to see a gynecologist, that is roughly about 3 hours away on either sides. So we have only 2 main referral hospitals, both centered on opposite sides of the country, and since I'm at the center, I can refer either way. And because of that, I roughly have to refer to either one, and it's very difficult to see a gynecologist. Some of my patients who I am booking currently have dates that are as far as into April, June next year. That is going to be the first time they see a gynecologist. And because as a country we are having so few gynecologists and they are so overwhelmed with seeing the entire country, you'd find that a lot of the reproductive issues are basically ignored, or there's not enough help that is associated, there's not a lot of help that they can get in terms of their reproductive issues. When I did my internship at one of the main hospitals there, we had a lot of clients who did come because of infertility issues, and the government has very limited spaces. Basically, the government cannot refer for IVF or IUI. So once a patient has been diagnosed as having androgenic problems, they basically have to take it upon themselves to pay for private facilities, which is very, very expensive. Recently, I think about 2 years ago, we had the very first IVF center that was established in Botswana.
Is it private?
Yes, it was established by Dr. Molelekwa, who currently does IUI and IVF. However, when I spoke to him, he did lament that they have to refer patients to South Africa. So all the laboratory investigations are done in South Africa.
I know. I tried to help and train the embryologists for them, but they couldn't find someone interested to be embryologist. So please, from this platform, if you find anyone who is interested to have embryology training, please call me immediately, because this is very, very important for you. Also, for your work in the future, you need an embryologist. So this is very, very important. By the way, doctors also can be embryologists. It doesn't have to be, you can have this training and then you can have embryology training as well, and you can do both. So this is also can be a good plan in the future. Dr. Musadami, I want to ask you, do you think by providing the 8 doctors from Botswana with this course, you are 8 from different regions in Botswana, will this reshape the fertility, reproductive health and the fertility care and women health in Botswana? How do you see that will affect the landscape?
Dr. Kalesh, Ms. Kalesh, that conversation of having doctors trained in reproductive medicine, that will obviously definitely begin that conversation, simply because a lot of us work in the clinics. When we work in the clinics, we are the first point of entry for a woman walking in. And most of the time, a lot of our women do not feel comfortable. And secondly, as doctors, we do not know how to handle reproductive issues. So once we get trained more and more, we can begin to have that conversation. As doctors in our community, we are influencers. We can begin to influence even the government of Botswana to change the legislature, because currently what prevents a lot of reproductive interventions is our constitution. Surrogacy is not allowed in our country. Most of couples have to go to other countries in order to conceive. And eventually, if more and more women are able to access, this may even reduce the cost. The cost, even in private, definitely you will have more specialists who open up centers.
I am very excited, and I am part of your journey, and we are going to do it together, not only in Botswana, but across Africa and across Asia. And we are going to approach and address Latin America as well, Central America this year, and they will join you in your platform. So thank you very much, Dr. Musadami, for this beautiful intervention. And as I said, we have 8 candidates. You are one of them. So we are going to call one by one now to have 2 minutes each intervention. So, Doctor, thank you very much, Dr. Musadami.
Thank you, and looking forward to seeing you in Botswana very soon.
Yeah, I will. After coronavirus, I'm sure you will find me. Siliwani Naiso, Dr. Siliwani Naiso, can you please?
My name is Dr. Siliwani Naiso Lithuenyo. I work in a small clinic, an outpatient clinic in the capital city, Gaborone. The clinic is called Glen Valley Barracks. It's in the army. I'm very, very thankful for the opportunity to study sexual and reproductive medicine. It's a topic that is very close to my heart as a woman that have spent 7 years struggling with infertility, trying to conceive But don't worry, it's actually a success story. I recently gave birth to a baby boy. Beautiful.
Fantastic. Congratulations.
Well, story for another day. Time permitting and the forum permitting, I will share my story.
Definitely.
Yes. So I will talk about the challenges of access to health, sexual and reproductive facility. While advances in infertility treatment have improved across the decade, access to fertility in my country remain a challenge. Price being the one that, as Dr. Butlale has already mentioned, that is very expensive to find help when it comes to sexual and reproductive health. While we have two fairly functioning referral clinics, big clinics with gynecologists and obstetricians, well, not a very large number, but we still struggle to find appointments for our patient to come and see the gynecologist. Actually, just like because she said the recent referral, the appointment is next year. My last referral, the appointment is 2024. I thought, wow, that was just too sad, really.
Yes. So it means accessibility is a problem.
Accessibility is a very, very big problem. Yes,
Because the lack of skilled and trained doctors, so there are not too many, so that's why they have a lot of problems to be accessible, and there are a lot of demand, and the present doctors and skilled doctors, trained doctors is too limited.
Yes, demand is high, but accessibility is very, very low.
Do you think,
Dr.
Selwani, do you think that this training course we are providing now for all these 8 doctors in Botswana will have an impact to resolve this challenge? Because look at the bright side. Yeah?
Absolutely.
It's not really now. This will change dramatically. This transformation will exist.
Yes, 8 is a very fairly good number, which I think it will lighten the burden quite well. So I think this is a very good.
Botswana is 2 million. Botswana population, how much?
Yes, it's about 2 million.
2 million. So if we have now 8, maybe next year we have another 8, it will make a big transformation.
It will make a huge difference. I really like the idea that you chose doctors from different settlements so that people can have access and have.
Yes. Yes, this was a major challenge. That's why we waited for a long time to select the right doctors in the right regions, that they are passionate, they have a good access to internet, and they are passionate about what they're doing and clever enough and all this. So this is was the right plan, and I think thank you very much for acknowledging this.
Yes, thank you very much.
Thank you very much. Thank you. So thank you, Dr. Selwani. And now can we go to Dr. Chow Bayamisi?
My name is Dr. Chow Bayamisi. I work in a primary hospital in Gumare. It's a small village in Botswana. But although it's a primary hospital, it acts as a referral for the whole sub-district. So before entering into like the objective or the future objective that I have, being given this opportunity, I would like to say thank you to Merck Foundation and Dr. Kelech for this great opportunity. It will really transform so many lives of women in Botswana in so many districts. I'll just briefly share my point of view from the place that I work in. So basically, we don't even have an SRH clinic where women can access help or just a simple consultation. So these women are already finding it difficult having to be seen as part of the OPD patients. So we all know that couples who have fertility problems, they require a long time specifically for consultation. So it makes it very difficult to see them in long queues of OPD patients. So this will actually help the country as a whole, because we won't necessarily rely on OBGYNs specialists who are very few at the moment. We as graduates of sexual reproductive medicine will be able to start the interventions where we are. So it is a very great platform. And as well as in numbers, this creates a platform for us to even know each other and also start to be a voice of reason, to communicate with our government and also to get the ball rolling. So thank you very much.
Thank you very, very much, Dr. Chow. Thank you. And we will be talking again after you graduate, or even between, of course. So we can see what you're doing in the course and what is the impact. Thank you very, very much.
So much.
So Dr. Kaidimi Louis Bozwani, Dr. Bozwani, also from Botswana. Dr. Bozwani from Botswana.
My name is Kaidimi Louis Bozwani. I am a medical officer working in Bobonom Primary Hospital. It's one of the primary hospitals in the country. And before I continue, I just want to say I'm very grateful for the opportunity because it's going to make a huge difference in the care of my clients. So basically, on most days, I see general outpatients, including HIV patients, pregnant ladies, and all the like. So as we know, Botswana is burdened with HIV, and a lot of the patients that I see that come with issues of infertility are the HIV patients. So unfortunately, like my colleagues have already alluded to, we have extremely limited numbers of specialists. And therefore, you find that you see the same patient for 5 years complaining of the same issues of infertility. They end up coming with problems, problems such as gender-based violence. Yes. Issues of depression, secondary to isolation related to this issue of infertility. So at the end of the day, it's very depressing that you can't really do much, because all you have to do is wait for that appointment for them to go and see a specialist. But having this training is hopefully going to limit all that waiting time. At least if I'm waiting to send the patient to an IVF center, which we would hopefully establish in the near future, we would be able to do certain investigations, prepare them for that appointment, the information or the knowledge.
Yes, you are right, Dr. Bozwani. You know what makes me happy, Dr. Bozwani? That every one of you from Botswana is coming from different regions, and when someone says small village or small clinic, this is exactly what I wanted. I didn't want everyone to be in the capital. Yes. And all the treatment to be in one place, because this is not the accessibility I'm looking for. I'm looking for that everyone in the rural area or in the cities around will have access. And this is the same plan, not only for reproductive and sexual health. We've done the same for diabetes, for cardiovascular, for other specialties. We are trained doctors. It has to be in different specialties. So when you look at the map at the end of 5 years, you find all of it full of dots. Green dots for fertility, blue dots for diabetes, pink dots for oncology, and then it will be all colorful map. This is my dream. So, I think it would be a great opportunity that we have such passionate candidates from different regions and provinces or districts in Botswana, like all of you. And I think we will have a lot of success stories, and we will have a lot of success stories for you and for the patients and for the women, and all these problems resulted from fertility, like violence, like all the child marriage, all these things will be resolved as more than a mother. Thank you very much, Dr. Bozwani. Thank you. And now I go to Dr. Mimi Raisima. Mimi Raisima.
Yeah, thank you. So my name is Kifilwe Ruthensunga. I'm a medical officer currently working in Mau. Mau is one of the towns that are in Botswana. So, and can I just say, this is a very a great opportunity for us to be here, and I also agree with my colleagues that this is going to make a huge transformation in our health system and also in our women, because I think infertility is one of those issues that I believe they are very, very important, but they are neglected. And I have been working in OPDs. Currently, I'm working in the hospital and in the OBGY department. So on most of the days, we help our gynecologists to see patients. So all these years when I've been working in the OPDs, I've realized that I have a lot of information gaps and skills gaps when it comes to managing these patients. Most of the time they present to you and you have no idea what you are supposed to do with them. And like some of my colleagues have already pointed out, the waiting time to see a gynecologist is a very long time. And currently in our hospital is in August next year, August 2021, which is very long. And so I'm hoping that through this program, this is going to close that gap. And, just during the training already, I've realized that, most of the cases of infertility are actually due to the male factor and that example. Yeah, so that is actually the exciting news that, not everything has to be IVF. Even me as a medical officer, I can say patient and maybe try to diagnose and manage that problem, and this could make a tremendous improvement in our system. And I think one of the things the questions that you have posed that I think we haven't actually.
Someone put silent, please. Yes, mute. Yes. Continue.
Yes. And can I also say that I'm very passionate about OBGY. And also, I'm thinking of specializing in obs and gynae. I'm actually looking into schools right now.
After you finish these things, we will talk about the specializing in obs and gynae, because we have also a diploma in obs and gynae in India, but you have to travel to it. We'll talk about this later when the situation is better. Thank you very much, Dr. Ruth. As an African woman, I am from Egypt as well. So as an African woman, I'm very proud with my sisters, African women sisters, and my brothers, African men as well, with us in this alumni, so they don't get jealous. So, but that because women are underrepresented in STEM and science and technology, that's why we always advocate for them. But my fellow sisters, brothers, men, you are already having your share, but we still support everyone. We support all the passionate young youth to reach their potential and to fulfill their dreams, and at the same time helping other people who need their help, like what we are doing at the moment. Thank you very much, Dr. Ruth. Thank you. Thank you. So now we are Dr. Sadi Kayalabali. You have to help me, the name, please.
I know. Good afternoon, everyone.
Afternoon.
I do have a very long first name. Even people in my country have problems with it, so that's okay.
What we can call you now?
Sadi is easier.
Sadi, yes.
So my first name, I'm Dr. Kwena Etapile Sadi Kealebale. I am a medical officer working in Maung in Botswana. I actually do work with Dr. Ruth.
The place you're working in. Where is it? In the
Maung.
where is it in the map? In the middle, in the north?
In the north. It's in the north of Botswana.
Yeah.
I do work with Dr. Ruth actually. So it is nice. Yeah.
Fantastic.
I am grateful to Merck Foundation for giving me this opportunity. And I am more than happy that today I've learned there are other Botswana women doing this program with me. So I know that for sure we are going to make a huge difference at the end of this program. My challenges as I have worked in the public sector, I find that there is a lot of stigma around infertility issues. Just starting a simple conversation on infertility is frowned upon. And infertility issues in Africa is a woman's issue.
Yes.
Men have nothing to do with infertility. So this makes it very hard for women to be open about it, to be able to go through treatment, and just moral social support is one of the greatest challenges in our country. So it is my hope that at the end, we will be, as healthcare workers, we will be able to disseminate information in our public sector, be able to start conversations and let the whole country know that infertility issues are alive. Infertility issues can be dealt with.
Dr.
That is one of the things I
am
want to
relying
see.
on you because besides that you are going to have help and support women scientifically, medically, but also psychologically and culturally and socially, because you are the one who will be the advocate for breaking the stigma of infertility, for encouraging men to speak up about their problems and join the journey with their wives, to make women feel that they are more than mothers and they are productive members of society, whether they have children or not. So this psychological issue is removed, so they can be even treated properly, because psychology of a patient, it affects very much the result of the treatment. Plus, it's very important that it takes a man and a woman to have a child. This is a must, has to be in front of every clinic. It takes a man and a woman to have a child in front of every clinic. So when they come to read it, please, everyone can have a small board like this. It takes a man and wife to have a child. It can make a big difference in your social media and your clinic, on the walls, in the bathroom, everywhere. So thank you very much. Thank you very much.
All right, thank you. Bye.
Great to meet you. Now we go to alphabetically. I'm taking all the countries alphabetically from A to Z. So we finished Bangladesh, we finished Botswana, now Gambia. And Gambia also, it's a very, very important country for me. Why? Because there was no fertility specialist at all in Gambia. There was no oncologist in Gambia. There was a lot of lack of specialized doctors in many fields, maybe all the fields in Gambia. And we have a very, very good partnership also, like we do with Botswana, with Her Excellency, the First Lady of Botswana. We have a very important also partnership with the First Lady of Gambia. And we have also partnership with the Ministry of Health of Botswana, very close, very active partnership. We also have a very active partnership with the Ministry of Health of Gambia. We are working very closely to make a change. And we have trained a lot of doctors from Gambia until now, maybe 11 doctors in many different specialties. And 2 of them are had already clinical training in fertility. But now we have almost 1, 2, 3, 4, 5, 6, 7 doctors joined from Gambia this course, either in September or going to be in March 2021. We have to start with Dr. Niji from the Gambia to give us a small brief about the Gambia challenges in fertility care. Yes, great to see you, Dr. Niji. I'm so happy to see you, and Gambia is very close. I came to Gambia and I visited there. It was really nice. I had a very nice, also beautiful fish in Gambia. And I met a lot of women childless women in Gambia, and they told me about their challenge. And now with this program and the 7 doctors who are going to be enrolled in this program, I think this also will be transformational for Gambia fertility care and women health. What do you think?
Yes, thank you very much. I think just like other speakers have said. Are you getting me?
Yes, I hear you. Yes, please.
Yes, thank you very much. Thank you very much for giving me this opportunity. I think like other speakers have said, the challenges of infertility in Africa, Gambia is also not an exception. Currently, we have a very limited number of specialists in obstetrics and gynecology, and we have through the Merck Foundation, a lot of people have been trained, like you said, about 7 people. I was part of the second batch who went to India to do training. And generally, the knowledge we gather from that place has really impacted our clinical service in the Gambia. And we are proud to say some of the patients have really benefited from our training in India. When we came, we have been seeing infertility patients, and then some patients have definitely benefited from it. However, we must say that Gambia, we still don't have an IVF center. I think that's one of the biggest challenges we have. Currently, we don't have any IVF.
I think now after you get
I think to do after this training,
you must be advocating for this in the
Exactly. We are making a lot of advocates to make sure that it is available, but we don't have any at the moment. And I think this training will go a long way in trying to help our country to manage women issues, because currently a stigma of infertility has become even a case of gender-based violence, where women are harassed at home because they could not have a child, and in most cases, which is not actually their own fault. So I believe after this training, this is going to have a huge impact on the Gambian population. As you know, we are not many, just about 2 million people. And if you look at the reproductive age of that population, it's almost like 30 to 40% of the population. So I think going to do these studies is going to have a huge impact on the women's health in the Gambia. Not only infertility, but other health conditions of women.
Health in general, yes, would be great. And you know what? After you graduate, 7 of you, you will be assets. You will be asset for the country. And then investors who want to invest to do IVF center and all this will be able to approach you. Because you know that if you don't have a skilled, trained people, nobody will even think to do it. And I'm sure there will be a lot of partnership you can get from other countries who want to have a branch of their IVF, for example, in Gambia, but they are very much hesitant. Why? Because there's no trained doctors. So I think after this will be a very important transformational, and then you can have equitable program for people who cannot afford, or people who can afford, and then you can make a very good access program to be able to cover your expenses and at the same time help other people. So thank you very, very much, Dr. Neji.
Yes.
And now I will go to, from the Gambia, Dr. Komba.
Thank you.
He is a new applicant, Dr. Komba, and are you here?
Yes, ma'am.
Yes.
Good morning.
Hello, good morning, Dr. Komba. How are you?
I'm fine, thank you.
Great. So, Dr. Komba, can you tell us a little bit about what do you think? You are a new applicant. Why did you apply for this course, and why do you think the impact of this on the Gambian women and the Gambia in general? Yes.
Yeah, good morning once again. My name is Dr. Kumba Seno, a medical officer currently working at the Edward Francis Moore Teaching Hospital, the Gambia. First and foremost, I must acknowledge that I am really honored to be selected and given the opportunity to pursue a degree in sexual and reproductive health. As an aspiring obstetrician and gynecologist, it has always been my dream to significantly impact and have immensely contribute towards women's health. So, especially when it comes to sexuality and reproduction. So the knowledge.
So do you think having this number of people who, doctors who join this course will actually affect and transform the women's health?
Absolutely. It will tremendously affect and transform the sector.
And you are working in the public sector, Doctor?
Yes, I'm working in the public sector.
Fantastic. And this is also a very important key. I know Gambia is a small country, but there is a lot of lack of trained doctors, and this is with the partnership with the Ministry of Health and the First Lady of Gambia, Madam Fatoumata Bahbayu, will be a great effect. And until now, did you ever meet the people we trained in Gambia before?
Yes. I am currently working with Dr. Njai.
Very good. We trained also doctors in diabetes and other specialties. I might have a special video conference for Gambia, and all the doctors have been trained from different specialties, so we can share experience and introduce you to each other. Because it's very important that you are together, because you are the one who will be leading the transformation of the healthcare in Gambia. I can tell you that.
Absolutely. That's
all
right.
of you. So you have to be together. Thank you very, very much, Dr. Yes, Dr. Kumba. And now Dr. Ramatuli Drameh.
Good afternoon.
Good afternoon. How are you?
I'm fine, thank you.
Great to hear from you.
Yeah, my name is Dr. Ramatulai Drameh. I am also one of the new applicants doing sexual and reproductive health medicine. I currently work in Carnegie General Hospital under the Department of Obstetric and Gynecology, an aspiring gynecologist myself. So it's an absolute honor.
Yeah.
No, an aspiring one. Aspiring to be one.
Mm-hmm. Aspiring to be one, for sure.
Yeah, exactly. It's an absolute pleasure to be able to do this course and be able to contribute and help the women of my country. Like the people in Botswana also said, we also have a very limited number of gynecologists in my country. So it's usually us, the medical officers, that tend to do most of the gynecological work. So getting the knowledge to be able to back what we do in practice would be an absolute honor. The infertility rate in my country, we have a very high fertility rate, 5.7% or so. So the small number of people
diagnosed, but maybe even more.
Exactly. So the people that don't actually get to have children tend to go through under a lot of stigmatization with the families, because then we also tend to live in extended families. So they get discriminated a lot for not being able to produce children. Yes.
And divorce, and second wives, and all this.
Exactly, because in Africa, women are only considered complete when they are able to produce, which is very, very sad. Because, like you said,
what we are saying, they are more than
exactly, we are more than mothers. Absolutely, we are absolutely more than mothers. So it's an honor to be able to help them.
Thank you.
Yeah.
Thank you very, very, very much. Thank you very much, doctor. And you know that we have trained gynecology, oncology doctors. We have trained a lot of oncologists in Gambia. That's why I want to introduce all of you to each other, so we can actually share information and make a plan how to improve the healthcare in the Gambia with the partnership with the Ministry of Health and the First Lady of Gambia. She's very passionate about this. If you come with a plan, it would be great for her. So now, thank you very much, Dr. Ramatullah. Thank you.
Thank you
very much. Thank you. So, Dr. Simon, it's a good opportunity to see you.
It's a pleasure seeing you.
Yes. So, Dr. Simon, you're working in with other colleagues or in a different place in the Gambia?
Yes. Actually, working in a different institution, different hospital from my colleagues. I'm working in one of the regional district hospital in the country. That's like 2 hours drive from the main capital city, from the main referral hospital. I am privileged also to be given the second opportunity to be with Merck Foundation, to be trained in sexual and reproductive medicine. I had the opportunity sometime last year to be training in India, in Udaipur, with some other 2 colleagues who are also working in the Gambia now in their various hospitals, and then they are doing very well. With the clinical and experience knowledge that we gain from India, we are applying it now in our various hospitals where we are working right now. So being given this opportunity again to further our studies again in sexual and reproductive medicine is a whole lot of joy, and then imaginable experience that we will have, and then able to help our women in our country here.
And encourage other fellow men to speak up about their infertility and encourage them to join the journey of infertility with the wife, respect their wives, and they know that they can also be a cause of infertility. You have to do this as well, and put in front of your clinic. It takes a man and woman to have a child.
Sure.
Since you are the man now, you have to be unpopular in the man community.
Yeah.
Okay,
all right. Oh, thank you so much.
Thank you very much. Dr. Mariam Zhao. So, Dr. Mariam Zhao, can you please tell us a little bit about you and the impact of the training you anticipated for the Gambia?
Okay. Thank you so much. Yes, I am Dr. Mariam Zhao. I graduated in 2013 from the University of the Gambia. I studied, that's where I finished my bachelor's degree in medicine and surgery.
Dr. Zhao, you're saying you graduated 2013, and this is really refreshing because I am 1994, so it's just, it's like ages in between.
Yeah, I know, right?
Yeah, it's great.
But I am currently, I am mostly into physiology.
Yes.
But another interest area of mine is maternal health.
Yeah.
Because I know Gambia being a resource for setting, we have a lot of work to do when it comes to maternal
health
and reproductive health. So this is one of the reasons I have always been interested in maternal health.
Reproductive health covers the fertility care and cover the family
reproductive,
and all
everything.
Amazing. Yeah. This is really great. Thank you very much to Mariam Jautab. Do you think this training will make an impact in the Gambia after you finish? What do you see yourself doing in 1 minute?
Well, I believe it is going to have a lot of impact for the Gambians because reproductive health issues are not given much importance as far as I'm concerned. So I believe if we have more people, like more medical personnel trained in issues around reproductive and maternal health, it's going to be a very great boost for the Gambia. Personally, I feel that we are lacking when it comes to a lot of research in this area. So, and I am someone who is so much interested into academia. So because of that, I feel before we're able to do much in terms of reproductive and maternal health in the Gambia, we need to do a lot of research. And it is only through research and basing things on our local context that we will be able to bring a lot of change in the Gambia. So
and now connecting with this platform from different countries, you can easily have a good research because now you have this platform. And also the doctors we trained in oncology and other things, when we connect all of you, it will be a very good encouragement of research because you have access to data. So it's really
sure. So that's one reason why I am here. We need to strengthen the reproductive and maternal health research in the Gambia.
With other countries as well.
We share with other countries. So this is really fantastic, having a lot of different people from different countries. So we'll be able to learn from their perspective and improve on those ideas to be able to shoot that in the Gambian context. So this is why this is very important.
Thank you very much, Dr. Mariam. This is great. And I will be talking to you also again in the future, of course, during the course and after.
Okay, thank you.
Dr. Joyce Green Harris.
A very good morning, warm one to you, Dr. Rasha Talej, and everyone on board. Sincere gratitude and appreciation to the Merck Foundation for this great opportunity to do medicine.
Thank you very much.
Working at Kanifing General Hospital, the second big hospital in the Gambia. As we all know, the cultural pressure on infertile couples is so much that the self-esteem and standings of these couples, especially the female partner, is extremely low.
Definitely.
Thus, having a child will consolidate the standings of these women in society, especially in the general African society. I believe this training in sexual and reproductive medicine is a step in the right direction. Help them overcome both primary and secondary infertility.
This is great, Dr.
I'm also likewise excited about another area I've been hearing about being echoed, that is embryology. An opportunity to study more and further study and do a master's in this embryology would equip us better here to further, or in the near future, have a very good IVF center around this part of Africa.
So you are going to be in the sexual and reproductive health diploma, but you're talking about embryology. You mean that you want to be trained someone else in embryology, or you want to be in the embryology as well?
I take every opportunity with open hands. help my
This is great.
So if anybody else can train in this area, it's a great opportunity. But if we are also given the opportunity to train, it will better equip us.
I will register you to see the embryology training, because it can be also an opportunity for you instead of this. Yani, I will give you both, and you can check which one you want to have. Okay.
That's excellent.
Yes, great. Thank you very, very much, Dr. Jose. And now we are going to the fourth country, which is Ghana. As you know, we had our luminary. Some of you know that we had our luminary last year in Ghana, and in partnership with Her Excellency, the First Lady of Ghana, Madame Rebecca Akufo-Addo, and she is an ambassador of Merck More Than a Mother, like the First Lady of Botswana and the First Lady of Gambia. I enjoyed very much working with Her Excellency, the First Lady of Ghana, and she was a great passionate about our programs, building healthcare capacity, and all the requests of the Ghanaian doctors training in this field or other field was actually recommended by her. But also she is very passionate about educating girls and girls' education, and we had a lot of programs about this as well. She's also very interested in breaking the stigma of infertility, and we had a lot of stories and book stories for children about this topic, which I'm going to share with you, by the way. Just to remind me, after we finish, I'm going to share with you a children storybook we created for each country, tailored for each country, to educate children and adolescents about the importance of breaking the stigma of infertility, the respect, family values of love and respect since young age, which is very, very, very important. So now I will invite Dr. Pascal Kingsley from Ghana to share his perspective about the challenges of infertility in Ghana and the impact of this course of training. Knowing that Ghana has IVF centers in the private sector, but of course still need more. So the development stage is different than Gambia and Botswana, but it's really great that we can share experience with him as well. Dr. Pascal? Okay, Dr. Elizabeth. Dr. Elizabeth.
Yeah. Well, thank you Merck Foundation for choosing me to do this sexual and reproductive health program. I'm yet to be enrolled. I think my application has been sent to March 2021, but I'm an obstetrician gynecologist working in Konfanochi Teaching Hospital in Ghana. The hospital is in the center of Ghana, the center of the country. That is where my hospital is. We have a lot of gynecologists in Ghana. We have a lot of gynecologists in Ghana. And then we also have IVF centers, but it is private in Ghana. So we are yet to start an IVF center in the public sector. But I see a lot of women who come to my hospital who have infertility problems, and doing this course will, immensely help me. Like all the people have shared, in Africa, if you get married and you don't have a child, it is a stigma. And in Ghana now, people are going to school and getting married at an older age. And we all know that if you don't get married early, then fertility becomes a problem. Doing this course will actually help me to help me better to take care of women who, especially those, majority of our people have tubal problems.
Yes.
For some reason, that is what we are seeing. And then those who have immensely helped me to see to the women I see who have fertility problems. Thank you very much.
Thank you very much, Dr. Elizabeth. And see you for sure when we come to Ghana, because we are going to come for sure next year.
I'm a public health physician and also a district director of health services in one of the most deprived communities in Ghana. That is the Upper East region of Ghana. And I think access to fertility care, it's quite a big challenge, and especially when it comes to personnel who would be available to be able to give care to vulnerable populations. It's quite a challenge. We only have one regional hospital. We don't even have private facilities around to even be able to offer such services. And with even the regional hospital that we have, we currently just have one gynecologist. And I mean, equipping other cadre of staff like myself to be able to acquire this knowledge will enormously help in bringing the service to this population. And I can tell you that within that particular area, we're dealing with a population of over 1 million people who don't have access to.
Wow, in the north, you mean?
Yes, in the north, especially.
Fantastic.
Do
you have any idea if we have any other doctor from the north also in our program? Because I am not sure where. Is it only you, or do you know?
Yes, so I think currently it's only me who. Currently, I think I'm the only one, to the best of my knowledge, who is yet to actually enroll.
You heard the names.
Mine has been shifted to March.
So we will see that. Yes, you've shifted to March. Yes, definitely. So thank you very much, Dr. Zakaria. We will see you for sure when you come to Ghana. So Dr. Madison Adenosa. Dr. Madison, it's great to have you. Where are you from Ghana? Which part of Ghana?
Yeah, so I currently practice at Cape Coast. It is about 2 to 3 hours to the west of the capital in Accra.
Okay, so West Ghana. Yeah.
Yes, I'm from Ghana.
Stability in the west of Ghana regarding reproductive health and women health and all this fertility care.
All right, there are quite a number of obstetrics and gynecology specialists in Cape Coast. We have a teaching hospital in Cape Coast which has about 3 active consultants in obstetrics and gynecology. But I practice in the University Hospital, University of Cape Coast.
Yes.
We have one obstetrician who is visiting. Yeah, so he comes. There are other people in the West. In Takoradi and Co, they also have a few obstetrician gynecologists. Yes, so I am a family physician by training. Yes. So I practice at a primary center at a district hospital setting. It is a hospital that belongs to the University of Cape Coast. So I see all manner of cases, and I've been working with people with HIV from the year 2007 when I graduated from medical school. And these people they don't only have reproductive issues, they also have sexual issues. And with my training in family medicine, which we employ the biopsychosocial model, I believe I'm able to help these people. They may have the biological need of needing children and getting pregnant, but then there are a lot of psychological issues, the trauma to them, and then the social issues. By my training, I'm able to bring these people together, the couple together, and then discuss also the social issues that are related to their current.
So you think that this training will help you to achieve this, or?
Yes. So the theoretical basis will be further strengthened, and then I will be able to give some practical help as well.
Very good, very good, very good. Thank you very much, Dr. Adam. Dr. Madison. Very much for this. And we hope that to see you soon, and we see you after finishing the course as well, and see the impact reality. We have success stories with you. I will go back to Dr. Pascal because his connection is being cut. So can you please, Dr. Pascal, hopefully the line now is better?
Yes, please.
Pascal?
Yes, please. Thank you very much, Dr. Rasha, for the opportunity. To come back online again.
Which part from Ghana you are working at?
So I am from the northern parts called Upper West region, located in Wa specifically.
So it is with Dr. Zakaria somehow?
Yes, so we are neighbors. Dr. Zakaria is in the Upper East region. I am in the Upper West region.
Upper West, okay. Yes. Yes. Great. So accessibility and there also is a bit of problem regarding
Yes, so it's one of the major challenges for us in terms of access to fertility care, because it's about 12 hours drive from the capital, where you can find most of these private facilities that are providing fertility care, especially IVF. Within the region, we have just one gynecologist in the region who is based in the regional hospital and have to deal with all the referral cases from many of the districts that the cases come in with. In mine hospital, like I was saying, we are just 3 doctors in the hospital. I basically mind the obstetrics and gynecology unit. I see a lot of infertility cases, but then the challenge is getting them referred for appropriate care. So it's a very great opportunity that makes us given me, and very, very hopeful that after this training, I will impact a lot of the people of my locality in dealing with infertility issues.
I am very much looking forward to see the result of this training and to see you all graduated successfully and making a huge transformation in Ghana and your regions and across the continent, because you will also be able to collaborate together and add to each other skills and experience, which is really great. I'm very happy.
Yeah, thank you very much. I would also like to say that if there's an opportunity for embryology training for an embryologist, I am very, very open to that as an interest area, and I wish to develop my career in that direction.
Okay, after you finish this, we can give you the opportunity for the embryology, so you can do both in your area, because you have the lack of this in your area. Thank you very much, Dr. Pascal. Thank you. Okay, so Ghana is done now. Great insights. And we have now Kenya. And we have from Kenya 3 candidates, 3 applicants. We have Dr. Ruth now, Wami. From Kenya, so she will share with us her insights and highlights about the Kenya fertility care landscape and the impact of the training she's anticipating for herself and for her region and country. Dr. Ruth?
Okay. Thank you, Dr. Rasha, for the opportunity to study the course and to participate in this conference. My name is Dr. Ruth Wamai from Kenya. I work in the capital city. I don't work very far, but I work in a mission hospital where we serve a lot of people. So the challenges are different in Kenya compared to some of the other countries that I hear. For us, we have a lot of gynecologists trained, over probably 400 over the years. But then the issue in Kenya is that the pressure on the system is because of obstetrics and prevention of things like maternal mortality. So there's been very little focus on providing services like infertility for the women. So not a lot of training has been focused on that. So, but this year, we are, thanks to Merck, we also have been reactivating our Fertility and Andrology Society of Kenya. So they've helped us a lot with that. And we feel like the problem in Kenya mainly is advocacy, so that people can also spend more resources in providing fertility care and even encouraging insurance, HMOs, to also cover patients for fertility care, because it costs almost like 4,500 to access fertility care in a private center. So this area hasn't been developed very well in the maybe say the mission hospitals or the public sector. So I think my training in this course is going to enhance my care to these women, because sometimes they come and you've got nothing to offer them other than just directly referring them to a private center, which they cannot afford because they pay so much.
You know, Dr. Ruby, the first countries I started more than a mother was Kenya, and then Uganda, and then I went across all the countries. But I couldn't. We helped a lot of women who's childish women in Kenya by establishing small businesses, and you can see that in our social media. For example, there is a lady from Maasai. Her name is Nonkiba, and there is Jacqueline, the victim of the violence. Her husband, and she is in contact with us all the time. There is Grace Chips, Mama Chips, which is also we are helping. There is Shilpa, and there is too many other women. But I wanted someone to be in Kenya, like doctors like yourself, trained to be our champion there, because we want to continue with talking to media, raising awareness, media training, because the community is very, very important. Awareness to innovative methods. We are doing, we have even done several media training in Kenya, and we want to continue with that. So we're hoping that by our trainees who will be in this course, during the course and after graduation, you will be our persons there who's going to help us to continue with our efforts and not going to be scattered. And we don't have any other partnership in Kenya, unfortunately, but we are hoping that with you and the other colleagues that you can help us to make a change in Kenya as well, in many ways, because I know that Kenya also is very advanced and very nice in art and fashion, and we do a lot of fashion awards and the film awards, and do songs, local songs, and all this to raise awareness. We're not relying only on talking to people, but we rely also on other aspects. I will introduce you also to the winners of the Media Recognition Awards of last year and this year, so you can be with them as well and see how can in the future increase on making publicity about breaking the stigma of infertility, empowering infertile women, and so on.
Okay, thank you. That would be exciting.
Thank you. So after Dr. Ruth, we have Dr. Diana Ondieki.
Yes, hi.
Yes?
No, I'm here. Yes, it's Ondieki. Yes.
Great. So, Dr. Diana, it's your turn to talk, and of course, we want to hear your opinion and what you think about this course. And first, are you in Nairobi or outside Nairobi?
No, I'm in Nairobi. I'm a consultant obstetrician gynecologist and also a lecturer at the University of Nairobi.
Oh, great.
But I'm currently in the counties. We are conducting workshops going from county to county. So I'll be away from the city for the next 3 weeks, and then I'll be going back at the end of the month.
Great.
Yeah.
Great. So what do you think about this course, Dr. Diana?
No, I'm actually very grateful for the opportunity to be able to learn, because it's something I've been very interested in. And as most people who are sharing here, cost is very inhibiting to be able to study and to be able to get the expertise and issues. So I'm very grateful for that opportunity. And we actually have a great burden, just as Ruth has shared. We have a great burden in the country. Like 31% of the consultations we get at the main hospital where I'm based are just from infertility. So it's actually a big issue. And I heard Dr. Green sharing about his interest in embryology. Actually, also for me, that's my primary interest. So if there's also another opportunity to be able to study that, that will also be great. And I was very happy to hear about the opportunity to be able to conduct sex education, essentially create awareness in counties.
Do you prefer, after you finish this course, to go for a practical course about embryology better, yeah?
Yes.
Practical, not online, because I prefer that the practical one for embryology specifically to teach you how to do it would be a good thing.
Yes.
Yes, great. We'll do that. And do you think the stigma of infertility now is the same like used to be from 2000?
No, the stigma is there. The stigma is still there. It's horrible, actually. No.
Because I see media now talk about it more. Because before the media was not even talking about it.
Actually, the main reason why I'm interested is because I also want to try and restore dignity to women, because it's still a big issue. Without a doubt, it's still a big issue.
We need to bring something together that we can involve all the innovative ways. Children's stories we have, songs, video clips, movies, TV programs, all these things. Like we need to be in different perspective, songs and fashion and many things. So I think being also with women, it will create a little bit of,
And something else that we are seeing a lot of, most women are delaying to come for treatment. So by the time they come, either they're way older, so like even IVF will not apply to them. So if people can immediately see there's a problem and come in for care, that would really be great in our country.
Yes, this is about by social awareness in social media and the media. That's why we'll start to see this aspect and how we integrate it in our media training. The early diagnosis. We have Ruth, we have Dr. Diana, we have Ruth, and we want Dr. Arnold.
Good afternoon, Dr.
Hi, Dr. Arnold. How are you?
Fine, thank you.
Arnold also in the car, so yeah.
Sorry for that.
Great.
So
Dr. Arnold. Yes.
My name is Dr. Arnold Buga. Unlike my colleagues, I work in rural Kenya, Western Kenya, in a public hospital called Kakamega County General Hospital.
Very good.
I think the challenges cross are the same in the developing countries and also in Kenya is usually the stigma. Stigma is quite a big thing, and obviously when it also comes to male participation, it's next to nil. So, and regardless the number of gynecologists we have in Kenya, Dr. Ruth talked about 400, the distribution of gynecologists in Kenya is a bit amiss. I work in a region where we have 3 gynecologists with a population around 2.5 million. So there's a bit of a mismatch over there, and we're a referral hospital, having patients all the way from across Uganda. The impact this training will have, obviously providing evidence-based care to such to my patients, and also try and fight the stigma. Let my county and the country at large talk about this infertility, and just to bring down the stigma.
Yes, this is very, very important, and I know that we are going to be able to do it, and we hope that we increase this platform of trainees, because now we have 3, but I'm hoping we can have more. Actually, I want my team to register that we have more doctors to be registered in March 2020 from different regions in Kenya, which is really great. Thank you very, very, very much. Now we are going to Liberia. Liberia is a very, very special country for me, a little bit. Why? Because I know that they need a lot of specialized doctors in all specialties. And we are working very, very, very closely with the First Lady of Liberia and her office. And we also working through her with the Ministry of Health. And the selection of Liberian doctors to be the first fertility care and reproductive care specialist and expert in Liberia, it is very important, because before our programs there were none at all. And we started with 2, with actually maybe 4 to 5 doctors between fertility specialists and embryologists, and 2 of them now, 2 of the fertility alumni is with us today, and there will be also other doctors who will be in the embryology training as well. So I want to call, we have in total 1, 2, 3, 4, 5, 6, 7, 8, 9. It's 9 doctors between now and in March 2020. We're going to be a fertility specialist in Liberia. This is a great transformation from 0 to It's a big achievement, and this will make a big, huge change in reproductive health women, as I said before. So I would like to call Dr. Dennis from Liberia. He is fertility alumni before, as well as other doctor with Dr. Lewis, but Dr. Noaya will speak about the Liberia challenges of fertility care and the anticipation of. Dr. Noah is here, and the anticipating impact of this training on Liberia, knowing that we had this number of Liberian doctors who will be the future experts of the country.
I'm Noah Kopudolo Dennis, OBGYN, Liberia. I'm happy that I see some of my course mates here already online. It's good to see the faces attached to the name. Yeah, so before I start, I would like to, this is a surprise too, but thank you for the honor. Before I start, I would like to thank my senior colleague, Dr. Louise Photo. She actually convinced me to enter this program, because when the offer came through NMDA, I had just traveled to give birth, and I was reluctant, but she was the one who actually pushed me into it. And when she went for her training in Odapo and came back,
Dr. Noah, we're talking about Dr.
Louise Photo, Maple Photo.
Yes.
Photo. Yeah, she's the one who encouraged me.
She is with us now, so she might be able to speak also about this. Yes.
So and when she went to Odapo and came back, she was all braces.
Yes.
Yes, and then I went to Odapo with the other doctor who spoke earlier from Gambia, and we had a nice experience. The challenges in Liberia is, this is basically a reflection of what is happening all around Africa. But what is new now is, since our return, Louise and I have formed something of a chain of consultation. So she usually sends patients to me, I send patients to her, we look at HSG together, we make diagnosis together, we have started doing hydro intubation, we have planned 3 cases of IUI, which will be the first case of IUI combined at her clinic. So we have done a lot, but I would like to connect with what the lady from the Gambia, the doctor, said about research. From my experience from March till now, working predominantly seeing cases of infertility, Dr. Photo and I, what we have found out is most cases of infertility in Liberia is due to bilateral tubal blockage.
Due to what?
Most cases of infertility in Liberia, the etiology is due to bilateral, like 2 tubes.
Bilateral tube blockage, yes.
Yeah, tubal blockage. Those are the cases that we see a lot. Of the HSG that we have did, the HSG that we have did performed so far, 85% of them comes back with the bilateral tubal blockage. And that is why we need an IVF center in Liberia. As of date, we don't have any specialized center, unit, hospital for IVF. So with this diagnosis, we need actually IVF center. And I was happy because I follow you on Twitter, and I was happy that you were instrumental in inaugurating the first IVF center in Niger. So with that, I said to myself, it's also possible that she could help us to establish the first IVF center here in Liberia to cater to some of these cases. The final thing is the male participation, and I think some people already touched on it. A lot of times we have seen resistance from the male, and I like what you said when you said that we will be interested in seeing not only the females going to seek infertility, but when they are going, they should be accompanied by their spouses or their male partners. I think it's something that we need to create a lot of awareness on. Currently, as I speak, I have 3 cases where the female is okay, but the male partners now are resisting to do sperm analysis. Some are even resisting to do a repeat sperm analysis after the first have shown that indeed they have problems with sperm count. So we need a lot of awareness on this issue and to actually explain the science behind infertility.
Dr. Lewis, I want you, after you finish here, to send me the most important media personnel in your country.
Okay.
Who can work on, and this is all for all candidates actually, because we need to get this in our platform, because you are going to be the instrument or the factor or the person who will write what you're saying at the moment about the male infertility, about the prevention, about this, about that, early diagnosis, all this. So we need to see what is our media partner. I wish that every one of you has a media partner. Okay, so every one of you has a media partner who will be his channel to the people. And this is could be 2 of you has 1 media partner, or all the group has 1 media partner, or 2 or 3. But this is very important, so we can work on this. Thank you very, very much, really, Dr. Noya. And I hope that we are not inconvenient for you.
No, it's okay. Thank you.
That's good. So, Dr. Lewis.
Hi.
Yes.
Hi, Dr. Raja. How are you? This is.
Good to see you. Of course. I feel that we've seen each other before, because I have seen your video, I have seen your posters and all this, which we are going to do for all the alumni also, and I will show them your success story as well. So, Dr. Kuputu, I wish that we can meet very soon in Liberia, but our meeting was cancelled due to Corona, as you know.
Yes.
To make the proper and the formal launch. But I would like you to give us also an idea about Liberia, and this is very important for all the colleagues to understand.
Yeah, so there's a lot of improvement as it relates to infertility in Liberia since the training of Dr. Kopuzolo and myself and the 3 embryologists.
Great.
We have started, as she said earlier, we have started consultation and we have had some success stories. Although we are not doing IVF, but we are still using some fertility drugs like Clomid, and actual timing that we have some success story. Like yesterday, I called her and said that I think we need to have our society, because there is no fertility society of Liberia. So I was telling her that I think that we need to talk with the other doctors.
We have 3 embryologists, yes. You have 9 doctors, so yes. It's a huge number. I will be with you in the society.
All right, thank you. Yeah. So I think the next time we speak with you, we'll be telling you about our society. But we are on the right path.
Doctor, can you name it not fertility society? Because I am now chairing a new society. It's called the African Reproductive Care Society, and this is going to be launched very soon. And I think it's going to be better to have Liberia Reproductive Care Society. And in each country, I will send you to have a country reproductive care society. Because what I understand, there is a lot of fertility societies open before us and before our groups. And I want to have our group, reproductive care, because it's not only going to be fertility, but it is reproductive care in general, due to this course. So let us have this, will be a great thing, because reproductive care is not only about treatment, it's not only doctors, yes. It can be also media people, it's a care, community yes. awareness and all this, yeah?
Okay, all right, so basically I think that Dennis has spoken on every subject as it relates to Liberia. So basically, that's what we have to say. Thank you so much. Thanks, Mark, for helping us. Yes, and we're always there to give. Yeah.
Thank you. And now Dr. Peter George from Liberia. So, Dr. Rosaline, I would like to, you joined already in September 2020 as a new enrollment for the Sexual and Reproductive Medicine. I want to know your background and how do you see this working?
I graduated as an OBGYN specialist in 2017 because we started our own postgraduate program in 2013. Okay. And we have many OBGYN specialists now, but who treat infertility cases as they come. Like what you said, I work in the government when I completed internship in 2007. I worked in the southeastern region for 2 years. Then I came back to Monrovia and worked in the private sector. Then I joined the postgraduate program in 2013 and completed 2017. Now, then I went back to the private sector, and then now I'm with the public sector now, where I work at an emergency obstetrics hospital called James Davis Memorial Hospital.
Yes.
Cases of infertility, like you mentioned about the male factor. I had a case when we were doing this postgraduate program. There was this stigma, the sisters of the male partner of this couple always insulted his female partner. And when we did this, the semen analysis and did the ultrasound, the pelvic ultrasound of the female partner, we found out that she had no problem. When we did the semen analysis of the male partner, he was azoospermia. And when we brought the couple together, counseled them and gave them the results, he cried bitterly. Because for the female, she had a child before. And the sisters did not understand the situation. They just thought it was because of the female. That's why the boy wasn't having any child.
Yes.
To find out he was the problem. So we actually need to encourage.
Common for all Africa and all our communities.
Yes. And another thing with the stigma is the polygamous relationships that we have in Africa. It also stigmatizes, those who are part of the polygamous relationship and don't have children, and there are others who have children. So we really need to work on it in Africa. And what my colleague said about problems with infertility, we also have problems with treating UTI or STDs. Like in the public sector, everything is free. That's what the government has started for many years now. But the medications are not available. They are expensive, very expensive. Even the laboratory, like the hormonal profile that you have to do, they are very expensive. We have the machines for no reagent in the hospitals in order to help these patients with infertility problems. So those are things that we have to work on.
Yes.
In order to help those who cannot afford to pay for infertility treatment.
Yes, this is how you have to open it for the people who can afford to pay the cost, so to pay the fees, which is going to be high, and from the profit you make, you pay for the people who cannot afford. It's called the Equitable Access Program. People pay who can afford, and you take the profit and you pay for the people who cannot afford. So
what I'm saying is, for the public sector, All treatment
should not give the
all treatment is free.
No.
That's what I'm saying.
It should not be like this. It should not be that there is a certain category that they have to pay and the category that they take it for free. So
then we have to work it out with the government.
Yeah. This is applicable in several countries. You can actually look at the program.
Okay. I'm glad to be a part of this program.
Thank you.
It's a new, yes.
Thank you, Rosaline. Dr. Rosaline, this is why exactly when I thought to Dr. Koba and Kobotu, when you want to do the reproductive care society, that everyone of you has to have a friend. This friend is a media person.
Yeah.
This person is your media partner. He has to be with you in that. You invite him to be a member in this reproductive care, because this is the people who will be your voice to the community, whatever message you want to do. And that's why I said we call it reproductive care. I was going to send a communication about this later, but this is how I do it as well for myself. So we have to have a media partner that can be your voice to people. So Dr. Thank you very much, Dr. Rosaline. Dr. Peter George is
You
here.
are welcome.
Yes, I'm here. Can you hear me?
Yes, we are here now. How are you?
I'm fine, I'm very okay.
We thought that you dropped us.
Not really, I was just listening to our mother, Dr. Louise Boto. She's our own icon here. We have so much regard for her, and she has always been encouraging us on our platform, on the LMDA platform, encouraging young doctors to come up in terms of education, because she believes in education.
Very good. I'm so happy to hear this.
Yes.
Dr. Peter, so just that you are already joined in September, and I want to know what you think about anticipating the impact of this course and what you are going to do after that.
Generally first, I am a general surgeon. I work in one of the most remote part of Liberia. Generally in Liberia, if you ask our mother, she will tell you most of the Liberians, young doctors, they don't want to go out and give services to our people. So some of us who have interest in our people, and based on what they always tell us, we always want to be in the suburb to see how we can give back to our people. I am the medical director of Chief Jalalong Hospital in Bapolu. Bapolu is the catchment population of the whole of Bapolu is 83,758, and in this counting, this 83,758, we only have 3 doctors. Only 3 doctors and 1 referral hospital. A whole counting of 83,758 only have 3 doctors. And the CHO normally, like CHOs are these are administrative positions.
Doctors are specialized in what?
I'm the only specialist, and we have one GP and only one EMOG doctor in training that is sent for general surgery, for surgical rotation, like the emergency obstetric training.
So, Dr. Peter, how many in Liberia? How many gynecologists in Liberia?
It's not up to my knowledge. The reason is new graduates are coming up. But to be frank with you, the amount of gynecologists that we have in Liberia is never enough. If you ask Dr. Poto, she will tell you, because if we're looking for specialized OBGYNs in Liberia, she is she will be one of the first person everybody will talk about before you go to
only 2 or 3 in Liberia. Dr. Koboto, how many gynecologists in Liberia?
So as I was saying, we might not even have up to 10 gynecologists. Trust me, and that is it. And that
much less. Yes.
That is the bottom line. You understand? So in a county where I have 83,758, only 3 doctors, can you imagine that? The amount of load I have. I do general surgery right across. I attend to all emergency obstetric surgeries that comes in. I attend to all pregnant women that come in.
I hope you find the time for studying, Dr. Peter.
Yes, that is the challenge I have, but I always keep in time for it. That is the challenge.
Because this is your future and the future of the people you are helping, because the quality will improve all the time.
Exactly. So, you know, it is actually a very, very, very big problem. So bringing this training is very vital for Liberia. It is really.
Do you know, Dr. Peter, this is not only the training we are providing for these 9 doctors, but we also provide oncology training for oncologists. And we have already maybe quite a number now, I don't know, 4 or 5 people. And we have also the same diabetes diploma and the cardiovascular and endocrinology and respiratory medicine and acute medicine. I will have also, like I said, with Gambia, I will have a TC, VC with all the doctors who will be enrolled in different things in Liberia. So you can have one platform to help each other.
Exactly. So we'll be very happy for that if Liberia will be really prioritized, because the need is there, and Liberia we need a lot of specialists, because in terms of medical specialty, we are really down. We don't have a lot of specialists, and that is just the bottom line.
Thank you, Dr. Peter, very much. It's really enlightening, and I'm sure that all our colleagues from other countries are happy to hear this intervention and to be able to help when they can. I can see now we have who's missing, Dr. Johnny Carlos Miller.
Yes, hello, can you hear me? Hello.
Yes, I can hear you. Dr. Johnny, we are a little bit running out of time, so we would like to have a small intervention from your side, like 1 minute. What do you think about the course and the impact of the course?
Yeah, like I work along with, I'm Johnny Carlos Miller. I work as a medical officer at Redemption Hospital. So I work along with she's my senior. I think there's a start to everything. Some point in time, we didn't even have this fertility program in Liberia, and then now I see that we are up to 9 doctors. I think that's something huge. And I'm one of those that for this program. And after my completion of this program, I will help to work with those who are already here, as my colleague or Dr. Luis Mpoto, and then Dr. Poputolo, and any other doctors. And then we how best we can help move this field of fertility forward, because in Liberia, we don't have many doctors doing that. And then working in the Department of OB/GYN, I'm confronted most of the time with these cases, okay? And then sometimes we kind of we don't know how to handle it. So like we have a lot of challenges when it comes to intervention. So like what my colleagues said, we don't have an IVF center, and that is true. So we had a doctor from Ghana who was here, and then what he normally does was like he used Liberia as a screening ground. So he come and collect patients, and then he send them to Ghana. Yeah. So one of the challenges we also been having is the issue of cost. Okay, if you've been following or lately on news, Liberia is like among the poorest countries in the world, and then a lot of people that can afford. And that's why the government try to open or make those public hospitals to be free, because a lot of people can afford. Now, if you want to go for fertility treatment, just to do their reproductive profile alone, that is very costly, okay? So a lot of these people can afford. That's a serious challenge, okay? So even just to do
you know what, I want to start step by step. First, we'll start with having a good skilled doctors in the country. Then secondly, we'll start to see the people who migrate, who go to Ghana and the US and for treatment, they treat it in the country. Then the profit you make from these people, you'll be able to have a part to cover the poor people. So this is how it's done all over the world. It has to start by the skilled and trained people. It's still a long journey, but it will be achieved if we are consistent. And now we are speeding up. We are frog leaping the whole journey. hopefully by you, if you succeed, all of you, and graduate with distinctions and merit, then you will be able to achieve this dream quickly. They all rely on you at the moment.
Yeah, so that is true. Like as the number of interest in this field increase, as we have more doctors, I think that will serve as a platform for us to be able to reach out to our population. And then also, like my colleagues here, we are about to establish an organization, okay, and then create more awareness and then try to incorporate more doctors into this field. Because we have like, almost our population is around 4.5 million. I work in the capital city, which is really densely populated. And I can assure you that up to present, we don't have a very, very stable, or we don't have the laws, the protocols and guidelines that govern fertility treatment and care. So we actually need this organization. We need more doctors to be incorporated so that we can start to have a draft and then get things speedily done.
Definitely, Dr. Mela. Thank you very, very, very much. And we are going to be following up with you. Dr. Clarence Yaski.
Hello everyone.
Yes, are you here? Yes.
Yes, I'm here.
So we had an idea about Liberia situation and all this. If you just give us an idea about, you already been going to join in March. I know that you are not yet having any idea about the course, but what you're anticipating impact, what do you see yourself achieving, and why you wanted this course, just in 1 minute. I know that it's short time, but
okay, well, thank you very much. I'd like firstly to extend thanks to Merck for this opportunity. And I've actually been a doctor for a long time, actually. This will be my 30th year as a doctor. Yeah. So I just returned from the United States, where I had been for a couple of years. I'm a general practitioner and a public health practitioner also. I provided fertility care to the Planned Parenthood for 8 years prior to going to the US. So I have an appreciation for the need, and people have spoken about the need. Definitely there is a need. The younger doctors talked about the availability of services for people who have issues with regards to reproductive health. And even where we have gynecologists, we have an OBGYN ward, there are not dedicated areas to fertility care, even when we're talking about outpatient care. And so the need is great. I have a passion for the provision of equitable care, especially where it relates to women and children, okay? And I think this course will help firstly provide manpower, that is the training of people in fertility care, and also lead to the awareness that will lead to the provision of the infrastructure you need in order to provide this care that is so much needed in by our population. From 1960 to now, our fertility rate has dropped from 6.4. 2008 was about 5.1. Now it's 4.32. So there is certainly a need, and we hope that
Dr. John, Dr. John, the challenge is not about the fertility rate, because the fertility rate should be 2.3 anyway. It's not about this. It's about the human and reproductive right. Some people are having 12, 10 children. Some people cannot have. The incidence of the infertility is too high. 1 every 4 couples are infertile in Africa, and even more. So the incidence is so high. These people are not only suffering to not have children, they suffer a lot of stigma and social distress and violence and many other things that can impact the productivity of the society. So what we are doing, we are trying to encourage people to family planning. So the people who has 12 can have 2, 3. The people who cannot have, they can at least have the access to have the will to have 1 or 2 if they want, if they can. So the accessibility. But also, if they cannot have children at all, they should be proud of themselves and feeling that they are a complete person and not only has to be only mother or father. They are more than that. So the whole idea is to give the right access to health and information. So if you want to have children, you have the right to have the access to the right doctor to treat you if you want. But if you don't want also, you should be able to have yourself respected and appreciated from the community.
Certainly, I certainly
yeah.
do agree. I was just trying to lay a groundwork on why I think this will be, like you mentioned, it will be monumental. It will be history setting for us, and we look forward to being a part of this course.
Thank you, Dr. Clarence, very much. I am really looking forward, and you are going to join in March, so I hope that you like the course and benefit from it, and be in contact with others to help them as well with your vast experience. Dr. Wilmot Frank. Okay, Dr. Mabenzi Birandwa, Richard.
Yeah, Dr. Mapenzi is here.
Hello, Dr. Mabenzi.
Hello, good afternoon, good morning, good evening to everybody.
Everyone, yes.
Yeah.
So, Dr. Mabenzi, just in a few words to introduce yourself. You introduced yourself already. How do you see the impact of the anticipating impact of the course on your practice and the community you are living in?
Yeah, of course. Let me say that. First of all, I'm grateful to Merck Foundation and especially to Dr. Rafa Kelesh for my selection for this program. Thank you so much.
Thank you.
So the reproductive health, or let me say, emphasize on the infertility is a big challenge in Liberia. Yeah, it's really a big challenge in Liberia. I know my colleagues say that, of course, we have some gynecologists, but up to now, I can say that the gynecologists are very few. And besides that, the most of them, they are concentrated in the capital, in Monrovia. So other countries are left without gynecologists. Maybe you find maybe one in all country or one in two countries.
So you are not in the capital, Dr. Richard?
Of course, I'm in the capital, but I've been in other countries and I know what is going on there.
Yes.
Yeah.
Yes.
So
this will help because we selected doctors from different provinces, so we can have access across the country, which is good.
Yeah. So the demand is very high. It's really high, and the problem is, you see that the most of the patients that we see, we send them to the referral hospital because we know that that's the place where they're going to find a gynecologist. But the time for them to wait is very long. It's very long. Before you see a gynecologist, it will take you sometimes months. Sometimes you go there, you not even see anybody. So it's really a big challenge.
Thank you very much, Dr.
We know all the stigma that is behind the infertility. And actually in Liberia, what I've seen is it's like a women matter. So the men are think that they cannot have any problem with infertility.
So the male fertility needs a lot of awareness about it.
Yes. So we really need more awareness to emphasize on certain information, to motivate men to come to the hospital to seek care, because it's really a big challenge.
I ask you to find a media partner, like we spoke about, a media partner that you feel that he can be the voice to the media about infertility and about the information you're going to get in this course and in general about fertility.
Yeah, we really have to find a way to disseminate information, awareness, because women are really in trouble with the infertility. Some have lost even their partners because they cannot conceive or they cannot born. Some are even forced, their partners will go outside, have extramarital children and bring them in the house. And you can imagine the psychological trauma or disturbance that is happening to those women. So it's really too much. We need something to be done. And
we will.
I'm
we
sure
will do it
after the completion of this program, we'll really be able to help a lot of people.
Thank you very much, Dr. Richard.
Smile to them.
Thank you very, very much. Okay, so now we go. We can go to Myanmar at the moment because Malaysia, they are not here. So Myanmar, we can go to Dr. Keen Lat. Please.
Good afternoon, Dr. Rasha.
Good afternoon, and congratulations for the new IVF and the new babies.
Yeah.
Please give us an idea, small idea about this to our colleagues.
Now we have many success after we got the training from the Milan Center, IIRH. So we got the trainings 3 months duration.
Can everyone mute, please, the things, please? Yes. Yes, sir, Dr. Keen.
Yeah. So we got the trainings, 3 months training from Milan Center. Yes. Only 3 of us. One is embryologist, and now she is very skillful. And the other 2 are clinicians. Now we are running the center very well. Now we got the success, and then I sent the photos of us. So now we are very much thank you to Dr. Rasha and all.
The first public IVF or the first IVF in Myanmar in general?
The first IVF is, I think, in 2016. After that,
first public?
Public, yes. Our center is the public center.
Yes.
Yeah. Our center is the public center. Yeah.
Very good. Dr. Keen, yes. I'm very excited for you to go through the 1-year diploma and even further enhance your skills and experience to be able to help more people. And I would like to invite now, thank you very much, Dr. Keen. I would like to invite now Dr. Yuyu.
Yuyu.
Yes. Can you please mute Dr. Keen? You can mute your Dr. Yuyu. You can give us in 1 minute. Yes, you are a new candidate, so you did not have any training before. What was your background before that? Did you work in the IVF or you are a gynecologist?
Yeah, I've been OB/GYN doctor for about 10 years. And now I'm working at the Central Women Hospital together with Professor Kenneth. And after fertility center has established as a public sector in our hospital, I have to join this center because I got the training in China. And at first, it's a very challenging for me as a fertility specialist. So I'm very grateful for Merck Foundation to select me as a candidate to attend this diploma course. I think
Thank you very much, Dr. Yuyu. And I am looking forward for you to be more successful, and I see that this course will add great value to you and to the patients and the women in general. Thank you very much. I would like to invite Dr. Mimi from Myanmar.
Yes, can you hear me?
Hello, Dr. Mimi.
Hello, yes.
Dr. Mimi, I'm happy that the volume is good and we can speak to you clearly. Dr. Mimi, do you think that there is a stigma of infertility and stigma around infertile women in Myanmar also?
Stigma
around infertile women in Myanmar?
Stigma about the fertility, do you mean?
Yes.
Yes. In our country, now we are challenging with the subfertile couple. So some of the couples are very young, but some of the couples are very old. So now we are solving with all of these infertile couple. So we must fulfill their wish to fulfill to get the baby. So the main problem that we encounter is we don't have the how can I say? Our center is the only one public center. All the equipment and the doctors supplied by the government. But the main problem is the cost of the fertility procedures. So some of the patients are very poor in our country, so they can afford to get a treatment plan. So we must that our fertility center is a cost sharing center. So some of the couple need to pay their own money for the fertility treatment. So
some of them can pay, the people who can afford pay, and the people who cannot afford.
Yes. Some of the people,
Exactly. If anyone hearing from Liberia and Gambia, this is exactly the model I'm saying to you. The public IVF, you can share this information together, by the way, and they can give you the cost sharing model that you can apply as a proposal for IVF. So the IVF center is that public. It's not everyone has free, because there is some people can afford. Yeah. So they are going to pay and pay the real market price. And the people who cannot afford, they are the one who will take from this and get the treatment for free. So I hope this is for Dr. Clarence, Dr. Rosaline, Dr. Kubutu, when they're speaking about the IVF center and the proposal. This is the way that is called cost-sharing model. Maybe Dr. Mimi with Professor Keen can help us to share a model like this, so we can.
Definitely bring it to our hospital.
Please mute, Peter. Dr. Peter, mute, please. Mute, please. Mute. Yes. So, Dr. Mimi, can you continue?
Yes.
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 Yes, great. So thank you very much, Dr. Mimi, for this. And you are also received our training, clinical training for fertility in India.
Yeah. I got the fertility training from the Milan Fertility Center for 3 months. Yeah.
Was beneficial? Did you like it?
Yeah. Good. So I'd like to thank to the Merck Foundation to support for us.
Thank you. Thank you very much.
Okay, thank you.
Thank you very much. Now we are moving to Namibia. And Namibia, we have 1, 2, 3, 4, 5, 6, 7, 8, also 8 doctors that, because Namibia also, they don't have too many or maybe very limited gynecologists in the public sector. We don't have fertility specialists in the public sector. So this is going to be, this 8 doctors will be the first nucleus or the nucleus across Namibia to improve women's health and reproductive care. So now I will invite one of our fertility alumni, who is Dr. Lugono Dovi, who is also working in the public sector. Dr. Lugono, please can you give us a small insight about Namibia? Are you here?
Yes, I'm here. Are you able to hear me?
Great, yes.
Right, just a correction. I'm working in a private sector. I'm not in the public.
Okay, so you are, yes.
But just a quick one, because there are 8 of us that are going to present. Most of the challenges have been shared across, I think, from the other countries, so I'll not stress much on that. The issues that we're facing are basically the same, issues of accessibility, because we only have 2 privately owned IVF centers, and these are located in the capital of Namibia.
That makes it outside Windhoek.
Very outside from the capital, right? So I think what we're trying to do at the moment with this new program, where we've identified doctors from each and every region to try and help us be the focal people when it comes to primary prevention. I think our focus mainly at the moment will be sensitization and awareness in the community, and then we'll move up the ladder when it comes to the actual clinical provision of services. Like you rightly said.
Before you continue, I would like to acknowledge the partnership with Her Excellency, the First Lady of Namibia, Madame Monica, and the role that the Office of the First Lady is playing to coordinate between our alumni, the media training, even training to the wedding planners, wedding counselors, training for not only for fertility and sexual reproductive care, but also for other specialties like diabetes, cardiovascular, endocrinology, respiratory, and acute medicine. And also training for media, as I said, and fertility council, which is in coordination with Dr. Longono, because he is revising these materials and making sure that it's scientifically. It could be a very good business model because it has a busting model, that all the things that it is misperceived in the society about infertility and infertile women, we are mentioning it and we correcting it. So this is really good because this materials we are going to provide for media, we are going to give to all other alumni for their media partners. So it can be a good connection. The same way we are going to have this maybe reproductive care society in Namibia as well, so we can have the media partner with us in this reproductive care, because they are very good factor of disseminating information to community, like you said, raising awareness. So the most important thing was the selection of Namibia. They select them across the country, so it's not only from Windhoek, which is very important. So it can have a nationwide. I will give the floor to Dr. Longono to continue. Please.
Well, I think you've already mentioned most of the things that I wanted to highlight. I will probably give a chance to my colleagues to also say a few things.
But also you can speak about the training you had in India. How this was impacting your.
Well, I enjoyed the training. The training was very, very helpful. And so far, in terms of my personal experience, I think it has improved my clinical skills. In terms of evaluation of patients, we're not yet providing IVF, but at least in terms of screening and management of patients, it's tremendously improved.
Cases that, for example, that you, after you come back from your training, you've seen this case and she was like having no access to treatment for so long, and when you came, you've been able to help her or them?
So many of them. I think.
Give us an example.
Well, I know that I've got like a 50-year-old, not 35-year-old lady who has been struggling to fall pregnant. And she has had several scans before, and that showed that she's got hydrocephalus. And basically what we had to do is had to take her to theater for laparoscopy, and we had to do clipping. And then a few months later, she had to fall pregnant successfully, actually without even doing anything. So simple things like those that we're able to do. I think it's one of the highlights of the training that I did. Yeah.
Great. I'm so happy to hear this, and we want to record this success stories by videos and things after the corona, because it's very important to share with other people too. Thank you very much, Dr. Longo, and thank you for your participation to validate and develop the materials for the media training, which can be very much experience to share with the rest of the alumni.
You're welcome.
Thank you. So can we go now to the rest of the colleagues? I will start from the beginning. Dr. Angus Faba. Good afternoon.
Good afternoon. Good afternoon to everybody.
Are you in Windhoek or out of the capital?
No, I'm in Windhoek.
Okay. So please give us an idea. You are going to be enrolled in this program. Yes, great. So what do you expect from the anticipating from this program, and just give us your insights, please.
All right. Thank you for the opportunity. So basically, part of the reason why I enrolled in this program is because obstetrics and gynecology, the department where I'm working in, has captured my heart basically in all of the medicine, because it's something that works with both human beings, so both the male, both the female. And reproductive health as a separate topic on its own interested me specifically because when there was a time where I was working in the gynae, because we have sections, so I was in the gynae section, where you see so men coming in and they blame themselves for not being able to conceive. They already have it because of the cultural background and because of the belief. They already have it in their minds that if they are not able to conceive, it is automatically the woman's fault. And you will find no matter what you do, how you work them up and tell them that you are medically okay, so we need to examine your partner and see if the problem is on that side. They will even give you the answer themselves that, no, he's fine, I am the problem. So not only do I feel that it is just dealing with the medical aspect of it alone, it's also important for us to learn and know how to counsel these couples, or especially the women, emotionally, and make them aware that it's not their fault, it's not their problem, it is a medical thing, and they are more than just somebody who's here to give birth or who's here to conceive and be. They need to. I feel like women need to learn to know
appreciate
that they are
themselves and know their rights and have access to right information.
Yes,
because
exactly.
The conception is that their value is only to be mothers, and if they cannot fulfill the value, they feel guilty.
Yes, exactly.
Or to eat, or to live, or to do anything because they didn't fulfill their purpose. which is
Yes,
the
exactly.
only purpose they have. This misconception need to be corrected, really. Maybe,
Yes, exactly.
as I said, by two things I suggest that everyone has to have a media partner that he is going to be his window to people, and but also in your clinic, even before graduation, you always try, it takes a man and a woman to have a child. Women are more than mothers, men are more than fathers. And of course, with the training program that we are developing for the media, it would be great to have a correction of this misconception. Thank you very, very much, Doctor.
Thank you very
Agnes.
much for the opportunity.
And I think we now go to Dr. Martin Kampala.
Oh, thank you very much for the opportunity.
How are you?
Very well, Doc. How are you
Kampala
doing?
is the name of the capital of Uganda. Is it related? Are you have any relation to Uganda or not?
Slightly different. My name has a B and Kampala has a
B. Yes, I'm Egyptian, so I have the both B and B are the same for me. We have a problem in this pronunciation. So anyway, Dr. Martin, so can you please give us insight about the training and what you think about the impact that you are going to achieve?
Okay. First of all, I'm serving outside the capital, where the rest of our colleagues might be located. So in the area where I'm serving, there's actually no IVF facilities or any fertility services that is available to the people locally here. So I think that would also help us also to do justice to the fact that fertility issues have not really been given attention in terms of gender, because fertility has always been looked at as a female, not as men problem. And those women
joint responsibility, yeah.
And those couples that were looked at such had no avenue to seek redress to those kind of problems. And one part of it is that in a place where I'm serving, I'm also seeing patients on outpatient basis who have fertility issues. And I think
where are you in Namibia?
I'm in Walfish Bay.
Where, north, south?
It's in a coast.
Coast, okay, great.
Yes.
Yes.
So the fertility issues were not really done justice to in terms of approach, even by protocol in the public service system, where most of the patients actually go and seek service.
So I think you will be playing a good role in this, along with other 8-9 people who are going to join the program.
Yeah, I'm hoping that
we have the whole process, and also the networking can benefit from other countries. What is the protocol? Maybe you can apply it as well.
Yes, Doc. Yeah. Otherwise, all the other issues are similar to what the other colleagues have already mentioned before.
Thank you, Dr. Martin, very, very much. Dr.
Thank
Susanna,
you very much.
Thank you. Dr. Susanna Ingrid.
Hi, Dr. Raja.
Hello, Susanna. How are you?
Nice to see you. Yes, thank you. Briefly, I'm coming in with a very different concept because
we missed you, but I didn't. You are changing now the whole look. The coronavirus look, huh?
So I'm coming from a very different background, Dr. Rasha, because I am a phytotherapist, basically complementary medicine, alternative medicine. So it's quite a different concept, and having worked into different countries with that. So more and more with this program, what I'm seeing, I feel a sense of loss. I feel a sense of an incomplete mission because my hands are tied and not being able to deal a lot with the women issues. And every day I'm actually bombarded with women and infertility issues. But my passion is really for the campaign and the advocacy around the infertility issues. And so far into the course, I actually realized that we are so far-fetched as a country on how to actually deal and providing actually fertility treatment to our people and to our patients. So more and more, it's becoming quite evident that we actually have to start now, I feel I don't have to finish the course to do this. I feel we can start now. And one way we can actually do that is by lobbying government, is by lobbying our health inspectors to just have a separate department within the hospitals and the clinics that will just basically deal with infertility issues. Because our doctors are bombarded, they don't actually have the manpower, the resources. And as we know that infertility takes about it doesn't take 15 to 30 minutes, it takes a whole lot of time. So having that separate department within our hospitals and clinics will actually play a vital role. Just to quickly mention also just something, Dr. Rasha, which with Dr. Nguvi now, he's busy doing the booklet on understanding understanding infertility, and then as he was actually
for the media and the fertility the marriage counselor on this.
Yes. But then also I told Dr. Nduvi that, look, I was frustrated because I said, Dr. Nduvi, as much as the booklet is technical, we need to bring it very concept that the locals understand. But my biggest issue, Dr. Rasha, I must stress, is that, and Dr. Nguvi is in agreement with this, that we need to establish we're going to create a different booklet where we're just going to talk and raise about issues on stigma and infertility. So if we can actually bring out all the stigmas that we actually are rising and how to actually combat that. So I think that in a way will actually help the issues. Like, for example, we have where it says that a woman you have a cement womb or you're cursed. So having a book.
Not collect this in the book.
No. We want to create something separate, a booklet just to address the myths and
myth busting. Like
yes.
Okay, do it. I mean, this is what exactly we wanted to do at the beginning. Have a mythbuster book.
Yeah. So that and then also last one. Yes, and just the last one also, I'm glad we have more colleagues here, because I think for us now is that to actually try and find a helpline, Dr. Rasha, because we don't have a helpline. And I think it's also with the rest of the other countries is that there is not a helpline when it comes to infertility issues. So for us creating a helpline where our patients and clients can just call in, because we have helplines, for example, like for suicide, for all the other helplines. But if we can actually have a helpline where people can just call in and get information about infertility, I think that also would be a way.
Helpline, why don't do with WhatsApp now? People now don't do helplines anymore. We do WhatsApp groups.
Yeah, but Dr. Rasha, not everybody in the local rural areas have actually access to WhatsApp or Wi-Fi. We have, we have a support group. We have a WhatsApp support group with Merck heroines, but we're actually tackling the locals. The community is far-fetched because we are a vast country and not everybody has access to internet or even has a smartphone, but they have a simple phone where they can actually call.
Not need internet, it can be on the phone. If they can call the helpline, they can call WhatsApp. It's actually easier. I disagree. The WhatsApp is being made especially in our countries to reach the villages and because it's easier. It's easier for him to call.
But what about those who don't have a smartphone, Dr. Rasha?
WhatsApp doesn't need a smartphone anymore. It's just
we are still here. Yeah.
Anyway, we'll talk about this later. Let us do the books first, graduate, and then we can think about more.
Yes.
Thank you, Dr. Susanna, very much. Dr. Joseph?
Good afternoon, evening.
Hello, good afternoon. How are you? Full of energy, yes. Dr. Joseph? Yes.
Yeah, I'm very happy because I'm very happy to be part of this program. So I'm very grateful.
Where are you, Dr. Joseph? Are you in Windhoek or out?
No, I'm outside of Windhoek. I'm in the northern part of the country.
Good. Great. So, Dr. Joseph, tell us about what you think. What is the North is fertility challenges in 1 minute like this?
I've been working in the Department of Obstetrics and Gynecology for close to 2 years now. And almost every day I sit in the OPD clinic for 3 times per week. and almost every day I have to see a woman or women's with fertility issues. So it got to my attention. That's the starting point where I got like, wow, there is a problem here. And when I saw the opportunity to take up the course, I took it. I had to take it because I see the need for the people. I saw the need.
I hope that you really succeed in this course impressively, and you continue your help to these people and improve their access to all things, access to health information and change of mindset, which is very, very, very important. And you will be part also with the group, maybe doctor, like the rest of the group, to be working on with media and other people to educate them. And from North part, you can have a media partner as well, because it's very important. Even Dr. Martin from the coast, you can have also a media partner. Each one from his coast, I'm sure there was a media person who is covering this area, doing articles and all this. Should be your partner, that you may work together on one concept, which is raising awareness about infertility. This is the only way. So I think this is going to be great and will be explored more and more. Thank you very much. Thank you, Doctor.
First of all, good afternoon, everyone. I'm currently in Windhoek. I'm working as a I'm working as a junior medical officer in the Department of Obstetric and Gynecology. So just like how everybody mentioned earlier on, Namibia, like any other country, is not immune to stigma and lack of accessibility to fertility treatment. And I think the best part about Merck Foundation is giving us the opportunity to actually gain the skills that we require to combat most of these issues. But my biggest worry will be then not be able to effectively practice most of these skills that we are acquiring, or not be able to effectively treat the patients, considering that we have lack of resources or accessibility to infertility centers here back at home. At the moment, we only have two, like
what is back at home? What is the meaning back at home?
Like in the whole country, we only have two fertility clinics, and they are in a private sector. And people like our patients from a low economic status won't be able to afford. I think it goes about around about 70,000
when you study more,
per circle. Yeah.
Carolina, when you study more,
so I think that will be a biggest.
When you study more the course, you will understand that there is a lot of things you can do, not only to have IVF. There is 80% of the cases. Going to be
with the issue,
operational intervention, a lot of things that you can do, and then the cases which is need IVF and high tech, you can either refer to another IVF or you advocate, because now you are 9 people or we're going to be more. You can open a public IVF like it happened in Niger and Rwanda and Ethiopia, many countries. So this is need more than only. This will require a character. Doctor with a character, who will be able to advocate and make it happen. So
perhaps we'll be able to advocate for it.
Doing their job, and there is doctor who doing more than their job, and there is doctor who doing not their job but doing other things like managing and all this. So we will explore who can do this from the groups we are training. Just now, let us focus on our training, doing the things that required high tech and all this, because there are going to be 80%. Practice in them, build your name, and then one or two doctors from the group who will have different perspective in how to make this IVF happen. I cannot tell you what will happen. Experience happening everywhere. How and how this come to their mind and how their thinking map is, we don't know, because we don't. But we will find one of you that he will going to be able to do it. How? Not sure yet.
Hopefully with the numbers, and we'll be able to advocate for one in state, and then everybody else can benefit from it. Because at the current moment, it's very sad when you investigate your patient fully, then you find out they have tubal pathology and they can perhaps benefit from IVF. And then you tell them this is the end of the road for you. Unfortunately, there's nothing I can do for you. And then the only options then, at that point, there are only options with then private. very expensive.
At least they know that there is an option. Better than not to know at all and sit like this.
True.
Towards the road. Thank you very, very much, Dr. Carolina. So glad to see you. And I hope that you enjoy the course and benefit from it. Thank you. Dr. Cleopas? Honok?
Hello.
Yes, how are you? How are you, doctor?
Good afternoon, fine, thank you. My name is Dr. Henok. First of all, fine, thank you. First of all, I would like to thank Merck Foundation for giving me this opportunity. I'm currently working in a private facility. I was working in public hospital before I joined private, and I was working at the Department of Obstetrics and Gynecology. And I love the department, and I would like to pursue my study to do a master in obstetrics and gynecology. Currently, I'm in private, and I managed at the rural area of Namibia. I managed to set up about 7 clinics, private clinic in 4 regions of Namibia. And I'm currently busy building a private hospital that to meet the government halfway. Our government motivate public-private partnership. So I'm also taking part in that one. So I've met a lot of patients with a problem of infertility, both in private and state. And the government make it easier for public servant because they gave them good medical aid. 95% of public servants, they are covered with medical aid to make it easier to access their medical treatment. So I'm happy to take this opportunity because one Namibia, one nation, we have patients both sides, both state and private. So it will make it my dream more easier to meet the government halfway and to help a lot of patients with that conditions.
Very good. Like a equitable cost sharing program, you mean?
Yeah.
Yes, which would be great. Yes, fantastic. And where are you in Windhoek or?
No, I'm covering some 4 regions in Namibia, rural regions.
Where? South, east, where is it?
North.
North? Okay, great.
Yeah.
So great to hear this, and I hope that you enjoy the course and benefit from it, and train other people in the public sector, which is this is a model we are doing for the private doctors, that they have to be able to share this information with public sector doctors after they finish.
Yeah, and I hope one day we'll set up a group with my team. We are training together so that we can form up something to assist both patients in both regions.
This is really nice. Very much. So thank you very much, Dr. Clubias. And Dr. Lifa Maija.
Hello, Dr. Rasha Kelech.
Hi, how are you? How are you, Dr. Lifa? How are you?
I'm good, thank you. How are you, Doctor?
Lifa, I see your name is so long. Is this all your name or it's a mistake or something? No, it's your name?
Yes. Yeah, these are all my names. Everywhere I go. Everywhere I go, people complain that I have a lot of names, so they're all my name. But you can stick to my first name, Lefa. It's fine.
Dr. Lifa. Okay, fantastic. So, where are you, doctor?
I'm based in Tumeb, somewhere close to north, because our referring hospital is at the north.
Very good, very good. Dr. Lifa, so you are going to be in March 2021. So are you excited about the course, and how do you see this will help the North area where you are practicing?
Yes, I'm very, very excited, and I thank Merck Foundation for that opportunity. I will help my fellow colleague and family member, because I personally am from a family where it's either some people have children or some they only have one child. So because of from that background where I'm coming from, it gives me more, I'm more eager to learn how can I help myself, how can I help my family. And also at the hospital, people come in every now and then, they are coming in with questions, they want to be helped, but too bad enough. They come when they are too late, like age-wise. When they come to hospital, it's too late. Yeah. So if I get this training, and then we'll be raising awareness, television, radios. At least we will help the young ones. So when they get there, they already know what to do at the right time.
This is great, and you get your media partner. You don't forget.
Thank you, Doctor.
Thank you, Dr. Lifa. I'm so excited about the group of Namibia, and as I said, maybe we go another VC to connect all the alumni from different specialties, and hopefully that you connect with me very soon with your media partners idea, which is going to be very great. Thank you very, very much. Now we are moving to Nigeria, and we have Dr. Adwell.
Good afternoon.
Hello. Hi, how are you?
I'm fine.
We were planning to come to Nigeria this year, but with the corona, everything is postponed. So it was planned to launch with Her Excellency, the First Lady of Nigeria this year, but unfortunately.
Okay. All right.
How are you?
I'm fine.
Of course, Doctor is the program and your selection. It was in partnership with the Fertility Society of Nigeria and with the Medical Society, and also the First Lady of Nigeria. So I hope that you give us an idea about the stigma of infertility in Nigeria, and where are you in Nigeria also, and how you anticipate the impact of the course.
All right, thank you very much. I am in Ekiti State, southwestern part of Nigeria, and I'm very surprised that I'm not seeing a lot of Nigerians on this platform. I think that maybe the awareness was not
Please
well
try to find this awareness to us, because I was also surprised that, especially for this course, and we have almost 120 people from Nigeria in the diabetes, 160, but of course we couldn't enroll all of them. We selected, but for this course specifically, there were none. So I don't know, maybe the awareness, like you said.
Okay, I don't know. It's raining here, so I hope you can hear me.
I can, of course, I can.
All right. So the burden of infertility in Nigeria, as I have gathered, because I am in surgery department, in urology, so my focus is basically on male reproduction, male fertility. So I had to consult with my colleagues that are in OBGYN, and they told me that the burden of infertility in our center especially is about 25% of all patients that come into the OBGYN clinic they are dealing with infertility. And then, like someone mentioned earlier, the major cause is actually tubal blockage. But for male fertility, we've seen patients with retrograde ejaculation. We've seen patients that have varicocele, and after they have this surgery, their prospect actually improves. And then I think that prevention is actually what I'm aiming for, prevention. And then participating in this course is going to give me a rounded knowledge, so that I will know about female and then male fertility problems, and then I can be able to provide care to both males and females, and in partnership with the obstetricians in my center, because I don't think that there are many public sectors, public hospitals that are offering in vitro fertilization, but I think that there are lots of private settings. Also, the problem with stigmatization, if we can create an awareness, like you mentioned earlier, that women are actually more than mothers. So, and then it takes a man and a woman to actually have a baby. So I think, awareness is going to be well appreciated. I want to thank you very much for this opportunity, and I hope to be able to make the most of it. Thank you very much.
Thank you very, very, very much, Dr. Adewale, yes. Thank you very, very, very much.
All right.
And I'm sure that we are being in touch to be able also to raise awareness about this course in Nigeria for different provinces. Thank you very much. So now we are moving to Philippines, and Dr. Catherine Cananuzado Donato.
Yes.
Dr. Donato.
Yes, that's me.
Catherine.
Yes, good day. Good day.
Hello,
How are
hello,
you today?
Great to
I'm
see
good.
you.
Thank you. You too.
Please.
So I am.
The floor is yours. Yeah.
Yes, I am pleased to have been given this opportunity, and I would like to thank you very much for selecting me. I am a practicing obstetrician and gynecologist in the Philippines in a private hospital, and I'm also in the academe teaching biochemistry. Upon completion of the program, the knowledge that I have gained will help me simplify things to the people in the community as well as to my colleagues and to my students. And sharing this newfound knowledge is important and crucial aspect for me because I believe that knowledge is nothing if it is not shared and if you cannot explain or interpret it at the level of your audience. As you have said earlier, there are other ways of helping people, not only through IVF, it can be through making them understand their situation and what we can do for them. I think my advocacy would be on public awareness after this.
Great.
So that's it.
Thank you
Actually,
very
the problem.
much. I just want to ask you: is the stigma of infertility in Philippines
Here.
Exists?
Yes. Here in the Philippines, there's also stigma regarding infertility, and as you know, in the Philippines, we are 90% Catholic, and thus most of us believe that it is God's will. If you do not get pregnant, then that's it. You do not do anything about it. That's right. And mostly people, it's a taboo to ask people, when are you going to get pregnant? When are you going to have kids? So yeah.
And
I guess there's still
men understand that they are also can be responsible for infertility. It's not that the male infertility.
Yes. But mostly males do not accept that they have a problem.
Also.
That's
Okay, great. So it's the same. So also raising awareness about male infertility is an issue also. Great. Thank you very much. Thank you very much.
Thank you so much.
Thank you. Wish you good luck.
Thank you.
Thank you. Dr. Margaret? Dr. Margaret John?
Hello.
Hi. Hello. Hi. How are you?
I'm good. You are good? Still good, doctor?
Yes, I am. I'm trying to continue.
So I am Dr. Margaret Christy Limson. So I'm a junior consultant from a government hospital. So I work in the Department of Obstetrics and Gynecology. So it's a university and university government hospital. So I teach students, residents, and we have fellows in endocrinology and infertility. So if you understand, the Philippines is a very small country, but we have a population of about 110 million. Okay. So, but then we realized, when I was doing my training when I was a fellow in the government hospital, that we do see a lot of people who are not rich who still come and consult for fertility. So understand there are only probably 3 centers in the Philippines that will give what we call charity treatment or charity services for infertility. So I'm very excited because our hospital, I'm affiliated with the University of the Philippines, Philippine General Hospital. For the past 5 years, we've been planning to open an IVF center. It will be a government-funded IVF. Yes, we are very excited, but still, we are just still very excited because we are still, the structure is not yet there 5 years today. So with COVID, everything slowed down.
Make it faster now.
We hope, in 2 years. That was the plan 2015, 2017, but it is now 2020 and still no infrastructure. But we are still very hopeful. And we hope that we will be able to extend the services that, the people need, especially those who cannot afford the fertility services.
Definitely. Thank you very much, Dr. Margaret. Thank you. I wish you good luck, success.
Thank you, doctor.
Thank you. And now Dr. Marianella Angus from Philippines.
Hi, Raja. Good morning.
Hello. Hi, Dr. Marianella. How are you?
Hi. So I'm Nella Abat. I've been practicing repro endo for about 20 years, but I just started my IVF practice in 2017.
Oh, great.
So at present, we have around 7 IVF centers in the Philippines.
Okay.
And all are privately owned.
Okay. Okay.
And Philippines, we have around 134 reproductive medicine specialists also, majority of which are practicing in the capital.
So now, what do you think about the course you are going to conduct and the impact you are anticipating to help people?
Okay, I am enjoying the course right now. We're into week number 5. I think this is a very good opportunity for us, the 3 of us, Margaret, me, and Catherine, because I think infertility is fast becoming an issue here in the Philippines, and the Filipinos are aware that there are such treatments for infertility. So maybe we can spearhead some projects, and maybe like Margaret said, she's very excited with the public IVF center that they're planning. Maybe we can help them out with that also. And the experiences we will get from the course.
Thank you very much, Dr. Mariella. Thank you very, very much. And I wish you good luck and success in the course, definitely.
Thank you.
So now, thank you. Now we go to Rwanda. And now we have in Rwanda, we have 2 fertility alumni who conducted with us a clinical fertility program before, which is Dr. Jane and Dr. David. And we have how many now who are going to be in this program? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. 11 doctors will be from different provinces enrolled in these programs between this year and next year. So I will ask Dr. Jan Damaskin to have his intervention and share with us the information, knowing that he is working in the first public IVF, which belongs to armed forces, and this is the first public IVF and the first IVF in general. I think there's not even private IVF in Rwanda. He will confirm this now, and he will share with us a few his experience on success experience. We trained in this IVF the 2 doctors and I think 3 embryologists. And we see now Dr. Damaskin. Dr. Damaskin, are you here?
Hello.
Hello. Hi.
Hi. Yeah, this is Damaskin from Rwanda.
Hello. How are you?
Yes, I'm fine. So I'm a gynecologist by training, and I am a lecturer of gynecology and obstetrics in the University of Rwanda.
Great.
And first of all, I would like to thank you for the Merck Foundation, especially also Dr. Rasha Kerej, for this nice effort to help doctors across Africa and Asia to train them in fertility management and ultimately help women with infertility problems. So I want just to give in just a few seconds the picture of Rwanda. Rwanda, we are about 12 million total. And we have around 90 gynecologists in the country.
How much?
90 gynecologists.
90 or 19?
90.
Okay, 90.
90 gynecologists across the country. And most of them are just based in public hospitals. And with their effort, we have been able to reduce maternal mortality according to the Millennium Development Goal 5. But still we have many problems that has to be addressed in management of obstetrics and gynecological problem. Especially the management of gynecological problem, we have the problem of management of infertility. So because among the gynecologists in the country, there was no trained gynecologists before the Merck initiative of training doctors in the management of the infertility. I was the first one to be trained in 1918. And afterwards, one of my colleagues also was trained, and embryologists also were trained for the management of the infertility. And I can say that as you know, in every community, around 15% of the population has fertility program. And in our country, apart from obstetrical program, infertility is the first complaint of patients who are attending our clinics. So, and there is really a great need for fertility management in the country. So, as I said,
I want to ask you one question before you continue. Is the IVF center of the armed forces you have for the army hospital, is this the only IVF center in Rwanda, or?
In Rwanda, we have now 2 IVF centers. One is public. Yes, one is public in the military hospital, and the other one is private. Okay. So, but still, because as you know, the private clinic, most of people cannot afford the cost, exactly. So and the public center is overwhelming.
So you are the only public IVF center and the first.
Yes, of course, yeah.
Very great. And I am very happy that you shared with us stories about women who had suffered infertility for so long, maybe 10 years, 15 years, and you've been able to help them to have children. So this was really amazing stories, and I want to have these stories recorded from you and from our other colleagues. This is the objective why we are doing all this, to make this, to help these people. It's really important. Yes.
Yeah, it was just exciting for me and for the couples who were having those problems. Yeah. And I want really to thank the Merck Foundation for having helped us to learn this new clinical skills. You understand, gynecologists, by training, we were given the general training in infertility, but there was no specific training in the management of the infertility. And we are glad that Merck has helped us to get this special knowledge. And we are also happy to be using this knowledge to help the population.
Yeah, and this course also will help polish your skills even more and more. And we want always to be able to support your IVF because it's a public IVF and for training, the new staff or anything. So please remember that as well for the future. But do you think, doctor, with the training all these 11 people from Rwanda, 11 doctors from Rwanda, across Rwanda, actually, there are different provinces, this will help transform the issue of healthcare, reproductive care, and women's health in Rwanda?
I think it will be really helpful. Something particular with Rwanda is that we have many, I can say that the health system is well organized in the country, and people can access services, medical services across the country because there is a universal health insurance that is helping people to access, to get the health services across the country. But what was lacking is having those people who are trained. And I think training more people in the country will be helping a lot in the management of the infertility across the country.
I'm so happy about the achievement of Rwanda and the number of gynecologists in Rwanda, and then having this public IVF. Doctor, in your IVF, do you have psychologists or psychiatrists?
Yes, almost every hospital in Rwanda there are psychologists, but I think
especially for the psychological part of infertility.
I don't think so because in every hospital we have psychologists. But the problem there is there is no special training about the management of the infertility.
Okay, great. Thank you very, very much, Dr. Jean. Thank you. Thank you very much. I wish you good luck and success in the program. And now we are going to go to Dr. 1 minute. Dr.
David.
Yeah, Dr. David. Dr. David, I need to pronounce the name. Wisingi.
Yes, please.
Yes, how are you?
Hello.
Dr. David also has with me exchanging WhatsApp about all these also achievements and the patient he is able to help after many, many years of infertility and the success of the IVF, which is we are all proud of. Dr. David, please.
Yes, please. Thank you very much.
Your insights.
Thank you, Dr. Rasha.
Thank you. Thank you.
Yes, thank you, Rasha, and greetings to all my colleagues.
Great.
Much has been said about infertility, but I would like to thank you all for your support and the knowledge towards the managing of infertile couples. So without taking my time, I've seen the approach of infertility management as interesting, because the way infertile couples are managed is the way other diseases should be managed, from the healthcare, from the health center, referral up to the highest level. So looking at the infertility management, really we should look at it from the health center point of view. If we don't have so much skills like IVF, really after this knowledge I've acquired, you can really manage these couples as if we can manage at the health center levels. For example, I've seen patients who have been coming to our clinic, the public clinic, with the incapability or no capacity to pay from the private, and when I give them management proper one, not using much, not using much expensive drugs, and they conceive and they have a story to tell. So I see it as it's really a good package to manage infertility at all levels, not necessarily at the IVF big centers. We can know how to manage these patients at a low level, then we can transfer them at a higher level. So really, since we've got this, this knowledge as 11 doctors from Rwanda, we can always advocate or manage this patient at our lowest level possible, and where necessary they can go for IVF. Actually, I've seen
Dr. David.
some
Dr.
patients
David
conceiving
and
without really using much effort because of the knowledge. Yes.
Dr. David and Dr. Damaskin, you know that you have a great responsibility at the moment, because you need to take care of our colleagues from other countries who want actually to take the venture of opening public IVF or make a business case for it for the government. So you can help them and guide them so much. So because you have a success story, and maybe they can also be able to fulfill your needs, especially in Namibia, Liberia, in other in Gambia, Botswana. So I think this will be a great thing. Thank you very much, Dr.
Thank you,
David, very, very much. And now I want to go to the doctors of Rwanda, who is new applicants, because now we had our alumni, which is you and Dr. Damaskin. Dr. Chance, can you give us an idea about that you already enrolled in the program, and give us your feedback and how you anticipate benefiting patients after graduation?
Thank you. First of all, thank you for selecting me for this program of Sexual and Reproductive Medicine online course for 1 year. So this is really a great opportunity. So normally infertility, it is a cross Africa challenges, or it is a problem. Also in my daily practice, I count 2 to 3 cases per week in OPD of infertile case. So through this course, so I have realized that some infertile case, it not really need a to be referred to the tertiary level. At this level also we can help them. Or before starting this course, I used to once I receive infertile couples, I immediately give a transfer to referral hospital. But through what I have learned so far, I have realized that at district level, we may help them by doing first part of investigation rather than referring them. And also I expect to be a medical officer skilled enough to handle with infertile cases where I am working in the obstetrics and gynecological department. Thank you.
Thank you very, very much, Dr. Chance.
My name is Kapuru Onnorin. I'm working in public health. I thank so much to have this opportunity to study this program. In our country, particularly in our hospital, we have many clients who have a problem with the infertility. And the challenge we have is for some examination. And we have one gynecologist, and we have many partners concerned.
Yeah.
In this problem, we transfer, we send them to the referral officer, and someone that doesn't have money because it's very expensive to follow the problem.
Yes. So you see that this course will help you to be able to help people in your public sector and in an affordable and equitable solutions. Thank you very much, Dr. Kapuru. Doctor, thank you very much for the people who attended from Rwanda, and the doctors, I really appreciate your time and your sincerity. And I'm sure that we are going to have a great work together. Now Sierra Leone, Dr. Sulaiman.
So thank you very much, and for yet another opportunity given to us as young doctors. So presently I'm working at the maternity center, the main Sasha Referral Hospital in Sierra Leone, an aspiring gynecologist also. For Sierra Leone, we have so many challenges. Presently, we do not have any IVF center, which is a big challenge. And for now, we have two clinicians, myself and Dr. Amadou Sisse, who are seeing patients on an outpatient basis. So we do a weekly cover. There are so many lapses that we think we need to put forward and adjust with the help of Merck and then the government of Sierra Leone.
Sulaiman, we have, of course, partnership with Her Excellency, the First Lady of Sierra Leone and Ambassador of Merck More Than a Mother. And we had a partnership with the Ministry of Health through her. We are hoping to have a new list of doctors who are interested in having fertility care training, so we can improve access to quality care in Sierra Leone. Now I will go to Sudan, and there is Dr. Al-Sheikh Al-Tayyib Omar Karar, Dr. Al-Sheikh.
Yes,
and I'm happy to have you here today, and with our partnership with the Fertility Society and in Sudan that recommended you and your colleagues. And I would like to understand from you about Sudan. What is the impact of stigma of infertility, fertility care access, maybe similar in Khartoum, outside Khartoum, and all this? Can you give us an impact and in public sector in general?
Good afternoon, everyone. Thank you, Merck for giving us this fantastic opportunity to join this prestigious diploma program. I was honored to be selected by the society here in Sudan, the SHRES Society, the Sudan Human Reproductive and Endocrinology and Embryology Society. The practice of IVF, let me start by the infertility stigma. It's the same as in the Arab world and the African continent. The woman who is not able to reproduce is considered as a stigma, and the problem increases by the cost of treatment. The cost of treatment is very high, especially when you know that the the only access to fertility treatment is through the private sector. We only, as you know, Dr. Rasha, we have one center that is affiliated to the University of Khartoum, which is the Abu Layla Center, but still it's not 100% public. It's still the patient have to pay a great amount of money to do the investigations, the workup, the treatment, and so. The IVF program in Sudan started in the early 2000s by the Dr. Sir Al-Hassan, Dr. Yaqub Abdel Majid, Dr. Muhammad Al-Hafiz, and it began with 3 centers. At the moment, as I'm speaking with you now, we have 11 centers in the capital city, Khartoum. We have 11 centers, IVF centers here. And recently, for this, that is practicing IVF in the east province of Sudan, in the city of Port Sudan. That's the main port of the country. And I'm very happy to see that they're starting to have clinical pregnancies, and even last month. So it's a great news to us that IVF has started to flourish in the remote areas of Sudan. There is another 2 centers under one in the city of Madani and one in the western city of Ubayd, but still IUIs and workup and so what I'm trying to say is we are a country of 1.9 million square meters with inhabitants of only around 40 million, or less, short of 40 million. People are still, we still need more people in this country, and the fertility problem is a problem in Sudan. We have a lot of, we have a great percentage of infertile couples in Sudan, and the access to treatment, as I said, is only through the private sector. The clinicians who are practicing IVF, I don't think they're enough for this number of people of population. We still need more clinicians to do IVF in this country. We still need more centers, infertility centers. And we started by creating a program for embryology training in the Sudan Medical Specialization Board. This is one step towards the future of this practice, of this discipline of medicine. But there are some logistic problems. As you know, the country is going through a transition state, and we haven't started the first.
So apparently the accessibility outside the capital is less, and there is still need for more proper access to reproductive rights. The reason, of course, of this program is not to increase the population or anything. It's just to help people who cannot have access to have the equal access like other people who cannot afford to health and information in general. And of course, this will happen with this program, and also breaking the stigma of infertility in general. Working with this is that when they have access to health, they also have access to information that they are having the appreciation and acknowledging that they are more than mother. Thank you very much, Dr. Al-Sheikh. I think that the network is gone, but you already finished. Thank you very much, and I wish you very good luck in your training. Now we go to Uganda, and we have Dr. Flavia from Uganda. Thank you, Dr. Al-Sheikh. So we have Dr. Flavia Ojambo Flavia to tell us about the challenge of fertility in Uganda.
My name is Ojambo Flavia.
Yes.
I'm working as a medical officer in the main referral hospital, that is Mulago Hospital.
Mm-hmm.
And what I can say about fertility in Uganda is that Uganda is one of the countries with a high fertility rate, but with also very increasing numbers of infertility. So in Uganda currently, I think the first IVF center started around 2004. We have 3, which are mostly private facilities, and they're not, the fertility care is not incorporated within the government facilities because it's very expensive. We training, people are not trained to manage infertility service public hospitals, and we do not.
So you think
people are yet to understand about
to manage the fertility care in the public sector, which will help people to have better access who cannot afford. Thank you, Dr. Flavia, because the network is not so great, so we cannot hear you very well. But I understood the concept. Thank you very much, and I will go now, Dr. Queen, Laila, so to tell us also about her insights.
Hello, hello, Dr. Rasha. I'm a medical officer, just like they've already introduced my name. I'm Dr. Queen Laila Mbabazi. I'm a medical officer working in an outpatient department in St. Francis Hospital in Zambia, which is a private, not-for-profit missionary hospital. It's actually one of the biggest private hospitals that we have here, currently at a level of a regional referral hospital. In my day-to-day activities in the outpatient, I have met several infertile couples, but mainly of late, I think in the past 4 months, I've met mainly men coming in with just seminal analysis, and then I don't know how to go about it. So I believe with this training, it will enable me know how to go about it. When I see an infertile couple, how do I approach them? How do I advise them? Instead of just referring them to the specialist. I have profound interest for obstetrics and gynecology, right from during my internship and my undergraduate training. And I believe this training will provide a platform for me to further my career in obstetrics and gynecology, but particularly in fertility and then sexual and reproductive health among adolescents. Because I noticed most of the infertile cases that we have, when you look at the causes, recurrent UTIs, PID, that are usually gotten during adolescent stages. So I believe working with that population can help improve as they go into their adulthood life. Also, as regards this training, by the end of this training, my expectations would be, of course, deepening my knowledge in sexual and reproductive health, and also as well as working with various partners to plan towards the goal of universal access to sexual and reproductive health and their rights, including family planning as well, because I believe sexual and reproductive health is not only giving birth, but it's also as well encompasses preventing pregnancy when you're not ready to have the pregnancy.
Yes.
Then
family planning in general.
Yeah. So I think I'm good to go. I like what is going on. I've enjoyed the discussion from the various countries. Unlike what other people are saying, in Uganda we have about 200 gynecologists. So the number of gynecologists, yes, it may be few as compared to the population of about 45 million, but at least in my hospital, I have access to about 15 gynecologists who I work with. So they mentor me in several things. However, the IVF services, they do them in private hospitals, but they are able to mentor me in these other approaches. So I believe with this training, working hand in hand with them, it will be very good.
Are you in Kampala, Dr. Queen?
Yes, my hospital, it's in Kampala, it's in the central region.
You are in the central, which is good. So you are already in the central of, yeah, very good. Thank you very much, Dr. Queen, and for your insights, and I wish you good luck and success, and we will be meeting soon. I come to Uganda frequently, and Kenya, so I will see you for sure.
Happy to meet you.
Thank you very much. Now, Dr. Mugisha Dal from Uganda.
Yes.
Hello.
Hello.
Happy to see the people of Uganda are waiting till the end and did not get bored and still excited and they want to make it. Thank you. Great.
You're welcome. Thank you too.
Thank you, Dr. Dal. Tell me, are you from Kampala or?
Well, my name is Dale Mugisha and I'm from the southwestern region. That's almost at the border of Uganda and Rwanda.
Very good.
It's about 7 hours from here to Kampala, actually.
You know that this makes me very happy, really, because this is how I want to distribute this. So tell me, Dr. Dal, just to tell you, Dr. Queen and Dr. Flavia, I have done this program in Uganda, the second country after Kenya. It was 2015, and we've done a lot of programs to empower infertile women, almost 1,000 women. We have established for them childless women who did not have infertility children. And we established for them small businesses, chicken farms, and oxes and plows and cows and all this, and the catering services, restaurants, small restaurants in the villages, very, very far in the western Dororo and all this. And they were very, very excited, and their life changed totally. And if you see them before the project and after the project, they become different people, different strong women. Even the tone of their voice changed. The way they walk, the way they look is totally different. So I feel this is the best way to do a business study or study about how economic empowerment can change women, not even regular women, but women also who's been stigmatized and abused by society, how they change. Now the community respects them. They come to ask for work from them, to work to them. Before they were ignoring them, they insult them all the time. So the whole things have changed, and this is 1,000 women in Uganda, and you can see the videos in the thing. So that's why I'm very excited about Uganda. Yeah.
I actually watched you in 2015. You're
Really?
an icon when it comes. Yes, when I was listening to you, I could see the passion. It was on NTV. I saw you even handing over some of the plows and something.
Yes.
Your reputation precedes you when it comes to the fight of stigma. Actually, it's quite good.
Thank you very much. I wish with you, all of you, that we can continue this work even further and in different regions. So I'm waiting until you get to know the course better and get stabilized, and we can work together to achieve this more and more in Uganda. So, Dr. Dal, can you please continue? Sorry, I interrupted you.
No. That is very good because I can see the passion.
Yes.
When you spoke of Uganda. Yeah, I would also like to really, just like the other speakers before me, I'd like to thank Merck Foundation for the opportunity, honestly, because it's something that I have always wanted to do, but it's not something that's quite affordable. So I really thank you for the opportunity. I had started, I also would like to thank you because one of the concerns that I had was if I'm going to do this thing online, it would actually be very helpful if I had some hands-on skill or something so that I can be able to do this.
Finish this, and then coronavirus comes, we will send you 3 months to India for enhancing the fertility session.
Yes, that would be very fantastic. So I just wanted to say thank you because I actually had to say that.
All of you are having this opportunity, if you want.
Yeah. Yes. Yeah. So where we are, I serve the hospital where I am is a public hospital, and it's a regional referral hospital with a catchment of 2 million people.
Yes.
But even the next hospital just after us, that's also a regional referral hospital, something about a catchment of 7. There is no reproductive health specialist. So this is quite good. The impact of the training has already begun because, yes, I'm a gynecologist, but I had never taken into account, for me, reproductive treatment has always been, to the scope of IVF. But attending the course makes you wake up to some of these other things that you can do, like time sexual intercourse, like IUIs that can be actually done. And I'm planning to do my first IUIs very soon, in about 2 weeks' time. Yes.
But I can connect you if you need some advice about this IUI. I want to connect you with our first trainee who's already done training hands-on embryologist. And I will connect you with him. He is in Kampala. Okay. He's very helpful and he likes to mentor people. So he can give you some tips before you start.
Okay.
Maybe share with you a video or something, you know. So
okay, that would be very helpful. So I actually even watched.
Share the thing with them, please.
Okay. Yeah. So one of the other things is I think because I'm also a lecturer, I do some lecturing at the university here, which also has residents.
Everything you learn with them, please.
Exactly. So I'm actually thinking that we need to bring this into the curriculum and make the curriculum a little more stronger in the direction of reproductive health. So yeah, that's one of the things I was thinking. And then the other thing
project, please involve us in it because we want to help you a bit in this because it's
that would be good. That would be good. Yes, that would be good. And I also think just like the IBM started almost the size of a room, and now we even have a computer in our hands that's even more sophisticated than where it began from. I also believe this IVF, with proper research and all, there could be ways around it, ways of innovation around it. I think that can bring down the prices and make it more feasible. And I also think that with this training, if I could be more empowered to think in that direction and also to think in the area of lobbying. But if I will lobby for, say, a public IVF, I would need some technical know-how to be able to be better placed as I speak. So
I think colleagues who done this from Rwanda, and you can help you. The people from Myanmar, they can help you. People from Bangladesh, they can help you. That's why we have this connection. So you can connect with them, and they tell you how they got it. Thank you very, very much, Dr. Dal.
Thank you very much.
We'll be in touch for sure after that as well. Dr. Mark Madinga, Mark.
Hi.
Hello, hi. How are you, Dr. Madinga?
Okay, how are you?
I'm fine. So, Dr. Madinga, yeah.
So, many of my friends have talked about the things I wanted to talk to you about. And for me, I think, first, I want to thank you for the opportunity to start this course. I am a medical officer in a regional referral hospital in Western Uganda, Poto Regional Referral Hospital. And access to sexual and reproductive health services is a limited edition there. We barely can have a clinic running independently. So we see our patients in the general gyne clinic. And while I am in pediatrics now, there's a lot of questions from the community, from patient caretakers about infertility and around sex and reproductive medicine. So for me, the course is important because with just questions, you can actually solve a patient's problem, answering a question or directing them in the right way using the information you are obtaining. And I think we shall do better. I am pleased to know that there are so many other Ugandan brothers and sisters that are enrolled for the course. It's such a great opportunity. 3 months ago, I did hydrotubation for one of the clients that was battling infertility due to a tubal blockade. And yes, I'm happy to report that she's 2 months pregnant now.
Oh, wow. So, congratulations. Congratulations. A good news and a good sign that this course will be very helpful for everyone. And as well, that you have experience, you can also share with the platform if anyone wants to do such operation and didn't do it before. So this is great, Dr. Mazangi.
It's important to note that this patient actually managed to purchase her success. We did a lot of investigations that are not available in our public settings. We sent her to the private clinics for a hysterosalpingography. We sent her for so many other hormonal assays. And so I think many patients that cannot incur such costs cannot achieve such success. And I think amongst us, the group of doctors that you're training, we should embark on lobbying for prioritization of sexual and reproductive health services among the public sector. Yeah, I'm really grateful for the opportunity.
Thank you very, very much. And I wish you good luck and success in your course. And I'm sure that we are going to meet again to share the experience of the impact of the course. Now I go to Zambia, because now we are running out of time. So we have Zambia and we have Zimbabwe. From Zambia, we have Dr. Mulaya Mombambi to speak about Zambia. Yes. So, Dr. Mulaya.
Hello, good afternoon.
Hello, good afternoon. Another card.
It's been a long wait, so now I have errands.
Hello. Looking forward to Zambia very soon, hopefully next year. So, Dr. Mulaya, can you please tell us?
Yeah. So, thank you. Yeah, thank you so much for this opportunity. It's been exciting, and I'm excited to be here. And just to give a short report on what has happened, I went for the fellowship to India in 2019. I actually missed my graduation, because the day of my graduation for my for my MEd, for my obstetrics and gynae, I was actually traveling to India, so I chose to go to India and miss the graduation, and I don't regret it. It was an excellent experience. We went to a center where they're doing IVF. Their success is quite good. They're doing almost everything that's in the book, and we learned quite a lot. There were simulators, and I think it was a great experience. Yeah. So now to be enrolled for this course. To be enrolled for this course is actually
compliment all what you have done in the theory.
Yeah, the theory is actually amazing. Now I'm seeing most of the things that I didn't understand, even with the practicals. You know, you could do the practical, but you need to know the science behind it. So knowing the science behind it is actually exciting. Yeah. So with this experience, like all the people have said, you do get discouraged when you think we don't have an IVF center and oh, what am I going to do with all this information? But like the previous speakers have said, actually you don't need an IVF center to make a difference. The route that you take is actually, for me, I've decided even just breaking the silence about the infertility and though is actually a big step in the right direction. I'm now in a number of groups for infertile couples, infertile women. So I'm actually 13 years. Someone has never had an HSG done. So that there's actually very small things which we can do to make a difference. It doesn't have to be an IVF center. Just taking a history, teaching women about their calendars, teaching a couple. You know, I've got couples that came to me with infertility and things like that. But just telling them this is a fertile period. You talk about the cycle and just show them which days are fertile. I've had some who've actually come back pregnant without me doing anything actually. Wow. So it's really the small things that make that actually make a big difference. Yeah. And prevention, we cannot overemphasize prevention to prevent the tubal blockages. That's what the biggest problem is in Africa. Yeah. So just giving antibiotics, treating STIs, looking out for STIs.
Of infertility, if you about this thing. Yeah.
Exactly. Yeah. But then also there's been a downside where I felt really let down by the system, where I have this couple, they've got tubal blockage, they are crying in your office because there's nothing else I can do. You know, there's only one IVF center in the country, and the costs are like, it goes up to 6,000 in the excess of 6,000 for a cycle.
Private in the country?
Yes. Okay. Yes. No. There's no public IVF center in the country.
You can easily make one very soon.
And
after we train all these people, it will be very easy to do it, because it doesn't cost so much, by the way.
Yeah, excited. We'll be waiting for you. I think, so that's the downside, but there's still a lot we can do even without an IVF center.
No, we cannot do any infrastructure. We cannot own infrastructure. We cannot do infrastructure. But I have people who can be investor and can do something like this. And you have to learn very much the cost sharing. Now working with our Rwanda colleagues, working with the Myanmar and Bangladesh and the Philippines, and know about what is the cost sharing, because this is the key. You cannot have a public IVF who treat everyone for free, because there is a lot of people who will abuse this because they can afford it. They can do this. So you have to have a parameter to know who can be treated for free or not, and do the cost sharing program. This is the key.
So just one thing. So one thing that I've discovered, which was actually quite bad, is that, insurance companies, health insurance, they do not cover fertility, not even investigations. So these couples are actually on their own. They are out there, they are lost, and there's nothing that anybody else would do for them. So bringing it down to the public, to the poor, I think that would be a success, a great success, because right now, treatment like IVF is for the affluent, and that really makes me sad in that, these problems actually for the poor also, because infections are there, down there, they don't get treatment in good time because of being poor. So
that's why we're doing this awareness, to make sure that they don't go to the last step, which is very expensive. Can have early diagnosis, prevention first, then the last step they have is going to be a very small number, hopefully, that can be helped by charity, by other things, by the cost sharing programs. So there was a lot of steps that you do to reach to this, starting from your training, because after you train, your mind will work in a different way.
True.
Thank you, Dr. Malaya, very, very much.
Thank you so much. Okay.
So I think now we have from Zambia also, we have Dr. Mackenzie Bright. So great to see you, Dr. Bright. And
great to see you too.
Looking forward to hear from you after you join the training. And
it's been great. I think maybe I would love to sincerely thank you. It's been a great opportunity. I think Dr. Mwambe has said a lot of things. I'm Mackenzie Bright. I'm a registrar in the Department of Obstetrics and Gynecology at the Levi Mwanawasa University Teaching Hospital. I actually work with Dr. Mwambe in the same department. So it's been a great pleasure for me and a great step in my training. I think, like Dr. Mwambe said, we don't really have the public hospital that deals with IVF, but she's already mentioned quite a lot of things, that there's a lot of things that we need to do, because infertility management is really quite a challenge in our country, in the sense that most of the patients we have a lot of patients with infertility, despite them not coming direct as infertility. Most of them come with just vague symptoms in gyne clinic, but later on, after probing further, then you discover that it's actually an infertility case. So I think this training will really go a step ahead for our country, and we are looking forward to you coming and introducing that clinic in our country.
Thank you very much. And I also have to emphasize here about our partnership with Her Excellency, the First Lady of Zambia, Madam Esther, and the Ministry of Health, and the First Lady of Zambia was a very good instrument and a very active partner to select you, because all of you, we have 9 candidates for this course, that they are being selected by the Ministry of Health and the First Lady of Zambia, and she is also the ambassador of Merck More Than a Mother. We had worked and trained the media also to be able to break the stigma of infertility and raise awareness, and I would like to retaliate the same request I asked for our colleagues from Liberia and other countries. Media partner. Every one of you has to have someone who is young media partner who can online, on print, or TV, or radio, that can transfer all these messages. And everyone has his own ideas, what you want to transfer to the community, what type of messages, and this has to be your friend. That you go out, have a coffee, have tea, invite him for lunch. This is your person who will have to be with you all the time. This is your community awareness thing. And this is applied for everyone. And you are in different regions. Are you in the capital, Dr. Bright, or Lusaka?
Yes, I'm in the capital city. I'm in Lusaka, yes.
Okay, great. So this is going to be a great idea, and I hope that this will help. And I'm coming back next year for our luminaries. Hopefully to see you there.
That would be great. Yeah.
Good luck.
Okay.
So now we have Dr. Molimbi Gabriel.
Yes.
Are you in Lusaka, Dr. Gabriel?
No, I'm not in Lusaka. Actually, I'm in Kabwe, which is about 120 kilometers from Lusaka.
Fantastic. So, Dr. Gabriel, since you are away from Lusaka, of course, your training will be a very good, have a very value for the access of fertility care and women health in general in your area, in your community. Would you tell us about this in 1 minute?
Yeah, I think I've been working in obstetric, and where I'm doing also my fellowship in obstetric and gynecology. And I've been meeting clients with infertility problems. And we need to appreciate those clients who are coming to us with those problems, because many of them are not coming because of the stigma attached to infertility. And even those who are managing to come to us, sometimes we don't know what to tell them. Sometimes we don't know how to manage them. So I think this course has come to really help us to understand the problem that these women and men, especially also men, because for our understanding, for our culture, men do not have fertility problem. But for now, we know that it is equally shared between female and male. And what I like about this course is what they have brought the couple together in our consultation. Because before, what we're doing, I was referring the male to a urologist, for example, to be treated from there. But this course is bringing the couple together and they're not separated. And I like that, and it's given me the opportunity to have a thorough evaluation of the patient when I'm seeing that patient. Yeah, I'm really grateful to be part of this course.
Thank you very, very much, Doctor, very much. And now I would like to thank Dr. Gabriel and move to Dr. Mundia.
Thank you once again for giving me this opportunity to just have a brief talk. So I'm an ID physician at University Teaching Hospital, and my interest in this program really, just like my colleagues have already alluded, is to try and find solutions to the infertility in our community. I also run a key populations program that looks at high-risk individuals in the HIV treatment and prevention program. And of course, we've noted quite high number problems. So I hope that with this program, it would definitely help me with my clients in terms of having to have all those issues sorted out. Thank you.
Great. You know what, Dr. Mundia, I was always discussing with our alumni that I always like to refer to our patients more than clients. But
sorry.
also, yes.
sorry, I didn't get that.
I mean, we want to refer. We was agreeing that we want to refer them as patients more than clients, because you know, we feel that it is more for, of course, for helping them because they have seeking of certain condition. But doctor, you said that you are also teaching in a hospital, in a university. Will you be able also, like I was speaking to our doctor from Uganda regarding integrating part of this course in the curriculum and teaching more people what you're learning and this way?
Yes. Yes, so it is part of the plan actually to integrate the program. Also, we'll be looking at having to sensitize and educate the patients on.
Yeah.
We worry.
And students. And what about students?
Students as well, yes, because we are a teaching hospital, so information and the knowledge that will be gathered will definitely be
great
to the students as well in our program.
Yes, it would be fantastic, Dr. Mundia, because this is will be like train the trainer, and it would be great that we know part of the information which you think it can be comprehended by them at their level of skill and expertise, of course. I hope this will happen. It would be great. It will be adding a lot of value to us. Thank you very much, Dr. Mundia. Thank you. Thank you very much.
Thank you.
So now, of course, we're coming to Zimbabwe, and I thank the countries at the end, Uganda, Zambia, Zimbabwe, for waiting all that long, and because it's really exhausting. But I thank you very much, and I appreciate this very much. From Zimbabwe, we have Dr. Harrison. Dr. Harrison?
My name is Dr. Harrison Rambanapasi. I'm a gynecologist in Zimbabwe. I work for the government in a government hospital. I also run my small private clinic. Now in Zimbabwe, we do have about 120 gynecologists, so it's not really difficult to see a gynecologist in Zimbabwe, especially if you are... Sorry?
What about fertility care?
So it's not very difficult to see a gynecologist in Zimbabwe, but in the outskirts, it's a bit challenges. The challenge we have is with infertility treatment, because we do have only 2 IVF clinics in the country that are running at the moment. They are not in the public sector or in the in government. These are private facilities that are being run by private players. Yeah. We also only had, before Merck came to our rescue, we only had 1 embryologist in the country. And this embryologist was servicing one of the IVF clinics that are running. So the other IVF clinic actually had to import an embryologist from South Africa. So
just correct me if I'm wrong. In Zimbabwe, there was 2 IVF centers.
Yes.
Both are private. 1 embryology works there, and the other one imports embryologists from outside.
From South Africa, yes.
So in total, you have only 2 fertility doctors.
Currently, those are the ones that are running. So there are only 2, then they're in private. So the other one, like I said, was importing an embryologist. So they were doing mainly batch IVF, so that they can coincide their cycles with the time when they bring in the embryologist from another country.
Network, So now by training 8 doctors, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 doctors from Zimbabwe. Will this, in between this year and next year, will this impact in the transformation of public sector, fertility care in public sector?
Sorry, I didn't get your question again.
So by training these 10 doctors, which we are going to train between this year and next year, this will impact the idea of like transforming the fertility care in the public sector?
Most definitely, if particularly in the private sector, it's going to assist. What we have done in the public sector since our training, because incidentally I also received training under the Merck flagship in India. So what we are trying to do is to set up at least a fertility. Sorry,
Merck Foundation.
Merck Foundation, yes. So I'm trying to set up a fertility clinic at my public hospital, but the challenge is with costs and affordability and all. So you find that you see patients, you ask them to do 1 or 2 tests that are not available at the hospital, but the patients are not able to afford. So the training of this batch of doctors in sexual and reproductive medicine definitely will increase the options for our patients and will make fertility treatment more available and hopefully more affordable.
Yes, definitely. Thank you very much, Dr. Harrison. I would like now to move to Dr. Rotendo.
Yes, I'm here.
Okay, great. Hello, Dr. Rotendo. How are you?
I'm all right, thanks. How are you, Dr. Rasha?
I'm fine. Thank you for having you that late I know that it is a bit late for you after all this time. And also, Dr. Mangwari came back, so we will have his intervention after you, definitely. Dr. Rotendo, tell me, where are you in Zimbabwe? Are you in the capital or outside the capital?
I was previously working outside of the capital, but that was before I came to the capital to pursue a master's degree in public health, which I think together with the diploma in sexual and reproductive medicine will help improve the management of subfertile or infertile couples when I ultimately go back to outside of the capital.
Dr. Rotenda, do you think that you are going to be able to study both in the same time? You have time?
It is possible. It is possible. It may be a bit difficult. It may require a bit more input from myself, but it's very possible.
Very good, very good. Are you off now from work and for study leave or something?
Yes.
Very good.
So right now I'm currently off work and I'm on full-time study leave. Yes.
So if you study leave, you can do it because this diploma is actually for people who is working. So if you are doing the master in global health with this, it's like you are working and then you can do this.
You're working and doing the diploma is at the same time, yes.
Yeah. So great. I wish you very good luck and success. And you are going to be a very good help for infertile couples in the public sector as soon as you leave and you finish and you leave back. Where are you going back after you finish?
Mashonal in the east.
In the east. Thank you very much, Dr. Rotenda. Thank you.
Okay, so I'm Dr. Mubari, currently working in Bikita district as the district medical officer.
Yes.
Overall looking over 2 mission hospitals, 2 rural hospitals and 24 clinics. But I would like to thank Merck Foundation for giving me this opportunity to study the sexual reproductive medicine. And of all the facilities that I'm manning, the main challenge is they do not
Okay, Dr. Mandwani.
Focus on fertility or
Dr. Talia, the volume is not working very well. So sorry for that, but we can't hear you. So but of course we understand that you are happy with the course and looking forward to the graduation and helping others. But you can send us a message, written message, so we can read it for other colleagues because the volume is not working.
Hello, Dr. Aisha.
Hello.
How are you?
Hello, how are you?
I'm Dr. Onesai.
Hello, Dr.
I'm fine. How are you?
Fine. I'm great. Yes, we can see you now. Great.
Okay. All right.
So, Dr. Onesai, are you? Where are you from Zimbabwe? Which area?
I'm working in Mutare. It's one of the smaller cities, just in the eastern highlands. Working in the maternity department as a medical officer. And I also sometimes work in the FCH department, which is just basically the pediatric casualty.
Yes. Great. So this course, what do you think will help you in achieving after graduation? Why you are interested in this course?
I'm quite interested in this course because firstly, my maternal aunt struggled with infertility the whole of her life, and up to now, I think she's around 50 years and she has never been able to carry a pregnancy to full term. She had 2 ectopic pregnancies, and that's what sparked my interest mainly. So when I got accepted to study medicine, she was one of the very first people who came to my house to congratulate me. And she was so excited, saying that at least I would find a solution for her. So from that, that just sparked my interest in sexual and reproductive medicine. And then also in the course of my training in the public hospitals, I realized that so many women come in with infertility issues, and there's a lot of stigma surrounding that, and a lot of cheating and subsequent divorces that occur, mainly due to infertility issues. So I've just wanted to help in that regard, and also try and make sure that there isn't much stigma associated with infertility. So I hope that this course will actually equip me with the knowledge to do that.
I am sure it will, and I will wish you a very good luck and success, and you will make a great doctor and fertility expert in Zimbabwe. So I want to go now. Thank you very much, Dr. Onesar. I want to go to Dr. Tabiwa.
I'm
Dr.
here.
Daniel Turing. Yes. Dr. Daniel.
Yes.
How are you?
I'm good. How are you?
Innocent back here. Yes, great. Dr. Daniel, where are you from? Which part from Zimbabwe are you in now?
I'm working in Mashonaland West.
Okay, great. Great.
The province in Zimbabwe.
Are you excited about the course?
I'm very excited, and thank you for giving me the opportunity to partake in this curriculum.
Very good. And what do you wish to do with it after you finish? What is your plan?
To help my community, because my community, there's a high burden of STIs and subfertility as well. So
Okay,
I
so
think
there is a high incidence of infertility related from untreated infectious diseases.
Sorry.
There is a high incidence of infertility, which is
Yes, most of the
resulted from untreated infectious diseases.
yes, but
So
most
awareness
of the
is very important as well. So are you willing to, you are planning to do the awareness required? We are going to send you also awareness materials. You can maybe hang in the clinic and share it with your community.
I'm very willing to do that, working with media personalities as well, as much as we can to sensitize the public.
And getting your media partner from the media people. Just think about who is the journalist who I can make a friend with, so he can really put some information in the media to raise awareness about the people.
Yes, I'm writing a few names, a few ideas. I think I can come up with one.
Fantastic. Thank you. Fantastic very much, Dr. Daniel. Thank you very much. I think there is two doctors came back. Dr. Tabiwa.
This is Dr. Takwamrons. This is Dr. Takwamrons working in Mashonaland West. And actually, I'm in one of the remote areas, the rural areas, at a public mission hospital.
Hence the technical problem. Yeah. Yeah. So,
and like every else, the issue of like everywhere else, the issue of infertility, the issue of stigma in infertility cannot be overemphasized. And as I've said, that this is one of the remote areas in Zimbabwe with low-income people, but however, they do present with challenges of subfertility and infertility. And usually, most of the times, you are clueless as to how can you help them. Since there are only 2 IVF centers in Zimbabwe, as has been alluded earlier. But however, I'm happy to join the Merck Foundation, as it will give me a clinical expertise as to how can we help the patients even without the complicated IVF centers.
Yes, of course. Thank you very much, Dr. Tabiwa, very, very much. I'm looking forward to see you soon in person. So now, Dr. Innocent, Dr. Lorraine, are you here?
Hello.
Hi, Dr. Lorraine, how are you?
I'm good, how are you?
I'm fine.
Yes.
Dr. Lorraine, which part from Zimbabwe you are at now?
I work at a hospital called Banket District Hospital, which is in Mashonaland West. I am a government medical officer. Also, I am a first-year family medicine registrar. I just recently started my program in June, but I'm hoping that my diploma in sexual reproduction and medicine will complement my degree in family medicine as well. Before we started the meeting, I was going through our module and our curriculum, and we have a module on women's health, and I was going through it, but there's nothing there on infertility issues. So I really think that a diploma to do with sexual reproductive medicine will then complement my degree as a family medicine physician.
Fantastic. I'm so happy to hear this. And I'm sure that this will add a great value to raise awareness about the topic, break the stigma of infertility, help these women and empower them to have access to information and health, which is their minimal rights, and a change of mindset. Thank you very much, Dr. Lauren. Thank you. And I think Dr. Welcome, is Dr. Welcome available? Because I know there's few people had a problem in the network. So, Doctor, who is left? From Dr. Tapiwa, Dr. Masika, Dr. Masika, because I'm confused a little bit because. Dr. Masika was missed before, so maybe from Zambia. Dr. Masika from Zambia, we couldn't have him. So do you want to join? Okay. Dr. Kandar, the medical and scientific director of Merck Foundation, and he will be helping all of you if you need anything regarding the course. And Dr. Kandar, can you please join with the video and the volume so people can see you?
Hello, Dr. Rasha.
Hi. Dr. Kandar is going to be
hello everyone.
Medical manager, and he's the one who is helping you for your guidelines and for signing and helping you in if you have any problem or anything regarding your course. So please, I'd like to introduce him to you so we can approach him anytime you want anything. Dr. Kandar, do you have anyone missing from Zimbabwe at the moment?
No, I think everyone is
very good. So at the moment we have everyone, and please, this is the first time we meet all of us, each other, but it will not be the last time. We are always going to have this. We celebrate your successes in different modules, in different occasions, stages. We also have different platforms related to countries, like I said, with other alumni from different fields. I might sometimes prepare a video conference with the First Lady and representative from the Ministry of Health or Minister of Health with you, but this is in later stage as well. So now we have a technology that we have been adopted by the coronavirus pandemic, which are going to be using in our favor to meet each other more and to exchange experience and knowledge and have platforms to discuss challenges, advocate for things, and get to know each other more. So this is great. I would like also to introduce my team one by one to you, so you can also know everyone in detail. So now, Vino Nair, he is the Vice President and the head of ABAC. Vino Nair, can you please join by camera so we can introduce you to people, especially our new alumni.
Hi everyone, how are you doing?
Hi. Hello. Hi. So Vino also will be here if you need anything. Secondly, Leonard Saika is Senior Director of our programs and the head of Africa for Merck Foundation. Leonard, can you please?
Yes. Good evening.
Yeah. Hello. Hi.
How are you?
Leonard is from Kenya, and he will be helping you all equally, not only Kenya.
Everybody, yes.
across the continent.
Yes, and we introduced Dr. Kandarb. I have also Dimple Shastri, Senior Project Manager and Program Manager, and she's with us. Can you please join, Dimple?
Hi. Hi, can you see me?
Yes, she is the one who prepared all these logistics of these video conferences and our events when we are doing our events in different countries. So just for you to know, everyone. And now we have Veronica Damaskin is the head of my office, the CEO office, and also the head of protocol partnership. So please, Veronica, can you join by video?
Yes, good evening everyone.
Hello. So this Veronica, and then we have also Henda, Henda, Community Awareness Program Manager and Communication Manager of Merck Foundation. Mehat.
Hi everyone.
How are you?
Good, Rasha.
And then we have Barakuti Jani, Executive Program Partnership Manager.
Hello.
Barakuti.
Hi everyone.
Hello, how are you? And we have Sagar Dishmokh, Community Awareness Program Manager. Hello, Sagar. How are you? And we have Janini Kanga, Community Awareness Manager also.
Hi.
Hi, Janini. And we have Jaya Braya, Administrative Associate. Jaya.
Hi everyone.
Hello.
And we have, can you see her, Jaya?
Yes.
Okay. So we have Anoop. Jaya now. Okay. Anoop.
Hi.
Hi Jaya, now we can see you.
Hello.
Anoop, he is also the technical manager of the Merck. So I'd like to thank you all, my team, for make this happen, and I'd like to thank all our alumni and the future alumni, future experts. I'm proud of you all, and I am hoping that you are going to be the future experts, future healthcare leaders who can make transformation in the public healthcare sector, who will be able to make transformation in the women's health and fertility care and reproductive care in the two continents. Thank you very much for your time. I know it was exhausting, but it was necessary and very beneficial. I would like to have this in maybe every 6 months or 4 months. We can know each other all. Can you please mute? Mute. So, I hope this is going to be a great platform that you are going to be to connect together after we finish. Not going to be the last one. Thank you very, very, very much. Anyone wanted to add or say anything before I go? Please, this is an opportunity if you want to say anything. I can read your messages and all of you saying thank you and all this. Thank you very much. I really thank you. Thank you for making me part of your future, part of the public care, public sector healthcare and fertility care future, and part of helping and supporting infertile couples and women in the two continents. I am happy to be part of this journey and to be part of this success, and to have a legacy with you and to make history with you. It's very, very important. Very, very important for me that when I no more, either CEO of Merck Foundation or not anymore in this world, there will be a lot of people will remember me and remember that I was instrument in their future and their happiness and their success. Thank you very, very much, and see you soon. Thank you.